Itu asli, jual ya masih nak, masih promosi,
Please settle down. Thank you very much. And maybe before we start, there's a Wi-Fi connection here in the house, and all of you can join in. And the password is golf cart, small letters, all small letters, one word, golf cart, GOLFCART. If you can all connect, if you so wish. And the other thing is, I think you do have headsets that will be provided to yourselves if you do need some. And just to say that the channels are as follows. For English, there's channel 1. Sesotho or Setswana is 3. Sizulu or Sixhosa, you can use channel 5. And for Chivenda or Chisonga, you can use channel 4. There is also sign language. And for Africans, you can use channel 2. Let me take this opportunity to greet you all in the name of the Lord. And thank you very much for honoring this public meeting today. It is indeed a great honor to have all of you here. I welcome the MEC for Social Development, Honorable Morakani Musupie, and the team from the Department of Social Development, as well as honorable members here with me on the table who are members of the Portfolio Committee for Social Development. And most importantly, welcome all of you, the important stakeholders for this portfolio, social development. I really appreciate the manner in which you respond to our calls to attend these meetings, and I know they are very important to yourselves. You've got burning, pertinent issues that you would want to raise with the department, and the Portfolio Committee is offering you that platform to do so in their presence so that you can have meaningful engagements with the department, who I believe will give adequate responses to your concerns and your questions, so that when you leave here, you are all comforted that the department is listening, the government is listening to your pleas, and will indeed do something about it. And this is the relationship we want to maintain with you. And we hope that we will be able to sustain this going forward. I must say that we had a meeting this morning starting at 7 for the committee. We started at 9 o'clock for the first session, and this is the second session for the day's proceedings. So we will continue on that note. And from the first session, there's an item that we kept in abeyance because we wanted all of you to be part of that item. The presenter has joined online, and he will be able to give us the presentation because he's joined virtually. I also want to welcome all the stakeholders that have joined on YouTube and Facebook, and other members of the public who might have joined us this morning. I think before we proceed with the presentation on the, it's a presentation on the concept document for the Interfaith Sector Parliament. You would know that as the Portfolio Committee on Social Development, we host various sector parliaments. And one of the sector parliaments that we are going to be holding in the near future is a sector parliament on the interfaith community. So we will receive a presentation on the concept document for that sector parliament, so that all of us, including the MEC and the team, would understand what we are envisaging on this sector parliament. So when it comes to the purpose of this meeting, honorable members, MEC, and all our stakeholders, today, I think the main focus would be for us to interrogate the department's budget vote 6 as per the legislature sector oversight model. This is a process of the legislature. All committees do engage in this process. You would know that the budget process is one of the most important aspects of the committee work. And it gives members of the public an opportunity to witness how the department has prioritized its finances in order to achieve its objectives. Stakeholders, yourselves, need to interrogate the department and make sure that their needs are taken care of. So I would request that we should all try, by all means, to make sure that after this meeting, we have an idea of how the department is going to meet the demands of the vulnerable, of which the majority are women and children. So before we proceed with our meeting, I would request that we just observe a few house rules. Let's make sure that our phones are on silence so that we do not disturb the proceedings and not interrupt the audio as well. So if you could just mute your phones, it will be appreciated. So maybe just to check if the presenter is ready for us so that we can all get the presentation on the concept document for the Interfaith Sector Parliament. And it will be done by Mr. Prince Kubeka from the Public Outreach Office on Public Participation. Mr. Kubeka, if you are logged in, please go ahead with the presentation. And sorry, excuse my voice, it's a bit hoarse, but I hope that you can all hear me. Mr. Kubeka, over to you.
Thank you, Chairperson, and appreciate the opportunity given, and thank the committee and stakeholders present today. We shall deal with the issue of the Interfaith Sector Parliament, for which the committee is the custodian, as have been allocated by the chairperson of committees in the deputy chairperson of committees. Beg your pardon, Chair, with that. The concept document, Chair, is going to come up on the screen as I will permit, and I don't know if it's now on the screen.
Yeah, it is on the screen. We can see that.
Okay.
Yeah, you can just move it down slightly so that we can see it. We have lost it now. It's no longer visible. If you can just reload it. Okay.
Okay, no, thank you, Chair. I am not going to go word by word on the presentation, Chair, lest we spend the whole day dealing with the presentation, but I'm going to touch on the pertinent issues that the committee might be interested to know. The Interfaith Sector Parliament, Chair, is held annually as one of the key listening posts by public participation to ensure that we respond to Section 118 of the Constitution, which mandates the institution to promote and facilitate public participation in all its business. As we have been through many instances of hosting the Parliament, there's been changes in the format. One of the changes was that the the sector parliament would be now led by committees and be part of all the programs of committees, including as well settling down to discuss and present in the committee so that we could get the stakeholders. The date that has been put down, it's the 2nd of June 2022, and the venue that has been chosen, is the Finetown Multi-Purpose Center, Chair. The summary is built on the current situation or the aftermath of the COVID-19 processes, and how, as a country and as the people who have re-established ourselves back to the normal way of doing things culturally, as we would know. We're also touching on the recent event of the November local government elections as one of the cornerstone of our democracy, that South Africa must hold regular, free and fair elections so that it can promote its democratic stand. The introduction, Chair, it's solely about what the legislature envisaged to get out of the participation of the people of South Africa. What we have highlighted in the introduction, Chair, it's 3 issues that we thought were of grave importance. One was to highlight the issue of the gender-based violence, but with the focus that we would like to take a different approach on the boy child and how the boy child is raised, including in that was to take through how the faith sector can assist the society to arrive at that. The second issue that was raised was the increasing incident of child abduction and the growing trend of human trafficking, and as well as the murders that are ever increasing in the country. With the recent one, where we would like to say to the Kati family, may they be comforted and may the fighting soul of Hillary Kati rest in peace. So we're looking into that and how we can infuse the sector to also try and assist us in as the legislature in shaping policies for us to move going forward. Chair, the objectives are very simple. It is to provide a platform and to encourage the interfaith to take part in the legislative processes, mostly to robustly lobby and influence policies that are going to be biased to the sector. And focusing again on the mandates of the institution, we're also saying that public participation remains the cornerstone wherein our people get to have the say in what the legislature should achieve. We're also putting an emphasis that this is then to align the Department of Social Development with other provincial departments to make sure that this program is diversified in all its approach, so that whatever that we would seek to achieve with the sector parliament, the department and the executive is also part of the program. Chair, we didn't deviate much from the theme that has been adopted by Parliament, which is following up on our commitment to the people of Gauteng. So we are sticking with that. With the proposed topics that have been put down, Chair, when maybe the committee would like us to also debate and also get a view after they have thoroughly debated, we've selected 4 topics that we think could respond to the introduction and the objectives that have been set. The first topic, Chair, is the faith-based organization. We're looking at families that faced a crisis of accessing social relief grants during the time when there was the lockdown and the people could not. And we're asking if there's anything that the faith-based can help us to set up structures that can assist should we face such a situation. also try and crack on the human trafficking, the adoption that is there. So the question is, what help is there that the faith-based organization can try and formulate for us? We're also looking in the second topic to answer a question about the police and the enforcement of the lockdown or of the COVID regulation. We're looking at the long-lasting effect of the July 2021 looting. We're saying, did the needy and the weak get hit hard? What role did the faith base play in this particular instance of assisting and ensuring that the impact is never felt so high by those that were affected? The third topic, we're evaluating the impact of the COVID-19. The question that we're asking is based on the anti-vax people in South Africa that form part of our society. We're saying, what should government do more as an advice that the faith base should then bring into the table? The last one, we're talking about the attacks on the state institution, the impact of the public political specs that it has on the rule of law. We're asking if the faith base cannot in some way assist us to come up or to come around with ways in which that we can strengthen the legislative part of control in this instance. As I've already alluded to, Chair, the date is the 2nd of June, and we are going to host the event in the city of Johannesburg at the Finetown Multipurpose Center. The targeted stakeholders, it would also be fitting for me to state that we are looking into the structures that the committee would also have set up to support the sector parliament in line with what the Interfaith Council and its local structures are hoping to achieve. We're also looking to host as many members of the provincial legislature as possible. We've targeted 3 departments. We're looking at the social development to deal with the issues of the vulnerable, as you have put it earlier in your opening remarks, Chair. We're looking at the economic development, environment, agriculture, and rural, so as well to respond to the issues of how can we develop and ensure that we improve in the socio-economic aspect of our sector. And we've also looking at incorporating the social development just to look at the aspects of security in our society. We will also be inviting the council speaker of the city of Johannesburg, as we will be hosting the sector parliament in the city of Joburg, the Provincial Interfaith Council and its local structures, the South African Human Rights Commission, CRL Commission, business leaders and academics chair. We're looking into making sure that all these stakeholders that are coming to take part in this, in the processes of our committees after the sector parliament has processed its resolution, they're going to form part and to enrich the discussions that would be taken going forward. How we have planned to deliver on the sector parliament, Chair, is that we want a planning meeting that is going to host 20 members of the Interfaith Council in all the regions of Gauteng. That will be held on the 18th of May. From the 20th to the 23rd of May, this is now the internal arrangements of a build-up towards the sector parliament, where we're hosting regional workshops, which workshops are going to also unearth issues from the regions, which are now going to take form of us ensuring that whatever that is put in the provincial paper, it is what the regions would have put through to that regional paper in line with the topics that have been raised. On the 24th of May, we'll have a preparatory session where now we'll be combining all the discussions from the regions to take forward for presentation. On the 25th of May, we will have the state of readiness meeting, wherein internally we look at how ready are we to make sure that we deliver successfully on this sector parliament. The 26th and the 27th of May are reserved for dry runs that would now be taking through our participants on how they should conduct themselves on how and respond to the house rules and the decorum of the House. On the 30th of May, we're proposing that we should have a feedback that should be attended by 10 representatives per region. These would now form part of what was discussed in the previous sector parliament, so that when we move on going forward, at least we do not have a repetition of what was discussed and resolved on. And the main event, Chair, as I've already indicated, it's at the Fine Town Multi-Purpose Centre. Chair, we've looked into the issues that might assist us to go forward. We've looked at the constraints and the risk analysis that we have come up with. We've said for the successful implementation, we would also like to relieve ourselves of few constraints that are there. We do not wish to have a lapse in the quality assurance, because that would mean that we deliver on a shoddy sector parliament. We're also going to be monitoring and complying to the regulations that have been put in place to minimize and also cap the coronavirus infections. We're also saying that the availability of presiding officers is another risk factor that we must also try and minimize. Internal collaborations and the consultation with the sector, Chair. In this instance, we would like to say, Chair, we have categorized the risk and came up with mitigation of all the risk that are there. We're saying the availability of presiding officers in the feedback session and the main session, we're categorizing it as a very high risk that would be posed in the event that we do not have their participation. But how we are going to be dealing with this, we have a public participation forum that is run by the Office of the Deputy Chair. We are always in consultation with them and ensuring that they play their role to ensure that presiding officers and the executive are then part of this very important event for the sector. Lack of consultation with the interfaith sector, Chair, we say it can have a very bad impact on the buy-in from the sector. What we're planning is we're planning to have a meeting that will be hosted prior to the event to solicit a buy-in and to also ensure that representatives that would be coming from the sector are part of the program, so that we can then get their involvement and ensure that the representation also is valued on their part. The inadequate buy-in from our partners, we are also going to be working with IEC and the municipalities to ensure that we have IEC to come and do a presentation on their outreach programs and voter education in all the aspects of this sector parliament, starting from at the regional level, provincial, and this would assist us to make sure that the partnership that we have is not compromised, and especially with the municipalities as we seek venues, and also the involvement of the presiding officers in that sphere of government, Chair. Chair, without any further ado, I will just run through the program of the day, which has been proposed to be in this format. We are expecting that the arrival, registration, and breakfast will start from 9 to 9:35. Within that, we're expecting that the participants would then move into the house without causing much of problems, so that we cannot have a late start, as we have noticed that if we plan properly, we are likely to start on time, so as to also capture all the moments on the as communication unit is arranging to have this event beamed live in our TVs. Chair. The start of the formal program would be started by the speaker of the day with the opening and the moment of silence. And then the following item on the program, it would be the declaration of the precinct. As we know that all events of the legislature held outside of the precinct, there's a declaration that is done to ensure that we comply to the standing rules of the legislature. The welcoming and the opening remarks will be done by the council speaker of the city of Joburg, Councillor V. Takama, and the purpose of the sector parliament will be done by the Honorable Speaker, Honorable Ntombi Mihwe of the Gauteng Provincial Legislature. As it would be in the plan, we would target the executive for the address, which is the keynote address. In this instance, for planning purposes, Chair, we have called on the Premier to be part of the program, though we know that the Premier might, if he is not present, delegate the MECs to be part of this program. We are therefore saying after the Premier's address, we'll get the IEC to deliver their input into the sector parliament, and thereafter we'll have the house orders wherein the topics would now be discussed and resolutions presented by the participants at the event. And we would have the response by the Social Development Portfolio Committee Chair, Honorable Kekana, and the recipients of the resolutions and comments would be done by the Chairperson of Committees, Honorable Sizakele Malubani Nkosi. The vote of thanks, we have put that item for the Deputy Speaker of the Gauteng Legislature, Menomvuyo Mhlagaza Manamel. Chair, that's about it, and that we hope that the committee would find our plan of the sector parliament fitting and give us the support necessary. Thank you.
Thank you. Thank you very much, Mr. Kubeka, for the comprehensive presentation on the concept document. I think it gives us a good idea of what or how the day will unfold and all the processes that you undertake behind the scenes, because not all of us are involved in the planning sessions, but at least we have an idea of how much work is being put behind the scenes before a sector parliament can sit at any stage. Maybe just to say that I think the reason why I wanted this to be presented to yourself, I think some of you will be invited to the sector parliament, so it was important to also for you to have an idea of what is going to happen and what it involves. But the most important thing is that we are all aware of how COVID-19 ravaged communities and instability in government. It requires government to respond to these new events, you know, like we might experience a pandemic of a similar catastrophe in future. So we need to, as communities, their policies to the new normal, you know, because to be quite honest, most departments were this and that, and at times breached their own policies because it was a state of emergency, it was a state of disaster. So they had to step up and do other things outside of their scope, which they never had to do before. So it is proper that, you know, we prepare properly as government so that should we experience future pandemics, we would better be able to handle them, so that there is not much, you know, instability in our communities and disgruntlement and fighting amongst ourselves, people fighting for food parcels, for grants, for this and the other. All processes must be put in place so that should we experience anything of a similar nature, we are able to deal with it smoothly, you know. So your inputs are very important because your inputs helps to shape government policy. because this is your government. You must really assist this government to do what you want it to do for you and what works best for the overall members of this society. So, and it's also important that we note that COVID-19 is still with us, though the numbers have reduced, and there's that advent of the increasing due to the variants, the different variants that come now and again. But thanks to vaccination, most of us are vaccinated now, and that's why we are even able to gather in this form. Just to say that 2 days, just yesterday I consulted the doctor because I was congested. And the doctor said, Refilo, if you had not vaccinated, I would say you are in danger, you have COVID. But because you are vaccinated, I can see it's just a normal flu because you had traveled to another province over the weekend and it's hot there. So it's just the change of the temperatures and the seasons. But if it was then, I would say you've got COVID, So I'm just emphasizing the point that it is important for those of us that have not yet vaccinated to really do so. If you had different views, please read more about vaccinations and this will assist you to change your mind around vaccinations because they really assist in reducing the number of hospitalizations and fatalities at the end. So without any further waste of time, honorable members and colleagues and our stakeholders, item number 7 on our agenda, we will receive the presentation by the department on the budget vote 6 for 2022-2023 financial year, as I've said. And just to say that as a portfolio committee, we received the same presentation that is going to be made on the 28th of May. We received the presentation from the department, and I must say that we had close to, on 28th of May 2021, that was last year. And at that time, we received around 33 complaints of NPOs who have not received their funding for that financial year. And this was also linked to the signing of the SLAs, as you would know. And I must say that this year, the committee has not received any complaints. That may be, I think, a good sign, from the department side, that indeed they are resolving issues related to NPOs. I'm not saying there are no issues. There are still those, NPOs that do have issues now and again, but as a committee, we have not really officially received any complaints so far. So as a committee, we thought, maybe the department is really responding to the issues. But then I think we will hear that from them as to how they went about resolving these issues amicably. And I think because you are here, you will attest to that. If they have indeed resolved your issues, you'll bear testimony to that. You will tell us that they have resolved your issues, and if they have not, you will still raise the issues. So for now, I will request the department to present both the budget and the responses to the follow-up questions. And in this regard, I will request the head of the delegation, our Honorable MEC. I will give her an opportunity to give an overview of the two presentations, and thereafter I will request her to nominate a dedicated official who will do the actual presentation. Honorable MEC.
Thank you very much,
Yes.
Chairperson of the Portfolio Committee. Allow me to send greetings to the honorable members of the Portfolio Committee on Social Development and your technical team. to also send greetings to the team that I work with that are administratively led by HOD Mhlongo. But like you said, most important of all, to send our greetings to the members of the public who have joined this meeting today. So, Chair, I think it's only proper that I indicate to yourselves that the HOD says she's got a bit of a scratchy voice. I think she's got the same problem that we have. So DDJ Kabasia is standing in for her, and he is the one who will be either presenting on behalf of the department or indicating to us on who is going to present as we go about our program. You made reference, Honorable Chair, to the good performance regarding the signing of the SLAs and the payments to the NGOs. But I think it's also important that, you know, we make members of the NGOs aware of the fact that we as a department work within the ambit of the law. We cannot in any way, form or manner, do anything outside the ambit of the law. So, as we improve and go about doing our work, part of the reasons is because, yes, we have improved in terms of capacity building in the department, filling vacant posts in the area of the CBC, monitoring and evaluation. And I must say they need to be commended because they did hit the ground running and made sure that they bring all of the matters that we found on the table forward and they address them. We are not at 100%. Our wish is to be at 100%. So I'd like to share just a few statistics with you that as we stand right now, 92% of the programs for the Department of Social Development, including ECDs, have signed their SLAs and the payments have been transferred to them. So out of the 92, 89% are for DSD programs only. So you see that the numbers are improving. And as members of the NGOs would know, the ECD function was moved to the Department of Education on the 1st of April. So when we handed over to them, 95% of the ECDs as work around signing of SLAs, compliance issues and transfer of money was completed. So we made sure that we don't burden the Department of Education with work that was not finished. So I really want to thank the team for the effort that they put in. Having said that, Chair, Friday I traveled to the KZN as per the invitation of the Minister of Social Development, and the reason why she invited us is that there is, as we speak right now, a conference on, I'm not going to quote the topic as it is, but I just want to give you a sense of what they are doing. So the conference is on eliminating child labor across the globe. It is hosted in South Africa for the first time, and what is important to note about this conference being in South Africa is that for the first time, well, it's the first time on the continent and the first time in South Africa, and for the first time, the minister saw to it that children and young persons in South Africa are part of the discussion panel. It has never happened before. This is done with, in collaboration with the United Nations. So we presented a case from year before last, South Africa, to make sure that our children, we have children ambassadors. As you know, we have the Children's Parliament working together with the Nelson Mandela Foundation. So the children ambassadors in the last meeting that we had with them in the Children's Parliament, they, through their manifesto, made it clear to us that, you know, they would want to be part of decision-making in programs that affect them. So the minister had their call, and she has been working together with her DG and the HODs across the country to make sure that happens. So as we speak right now, those young ambassadors from all 9 provinces are part of discussions and decision-making on issues and matters that affect them as children. So it's a first for South Africa, and it's something that we intend to make, to support throughout their tenure, which will last about, it normally lasts about a year or two, but at the most it's a 5-year responsibility. So on the 16th, back home now, I came back on Sunday on the 16th, it was the day that is recognized nationally for the welfare of the boy child. It is not a global event yet, but we think it should go there. So as the Department of Social Development, we have a number of programs around that. We are aware of the fact that the girl child has been taken care of, and it's correct that the girl child be protected. But we cannot leave the boy child out of, you know, the basket of services that we have as a Department of Social Development. So on Sunday, we launched the Men and Boys program, which basically focuses on investing in a boys' empowerment to reduce the rampant scourge of gender-based violence and address the plethora of societal issues. So we're hoping that as we go along as a department, we will have some of the NGOs that will be looking at that aspect. But like I said earlier on, we work within the ambit of the law. So when we do, which I hope will happen, do get NGOs that work in that kind of field, I hope you will understand that for us to be able to work with you, we have to do it within the prescripts of the law. Chair, having said that, I'm going to hand over to DDG Kabasia to take us through the presentation, and thank you for the opportunity.
Thank you very much, MEC. Good morning, Honorable Chair and members. Good morning, ladies and gentlemen. Chair, I'm going to take you through the follow-up questions arising from the budget vote 6 for the 2022-23 financial year. Okay. Apologies.
Just to indicate to our stakeholders, you must just listen carefully, take notes. If you've got questions or comments that you would want to make after the presentations, I'll give you an opportunity to do that. So I hope that you will all be able to see so that you can just take notes as and when you listen to the presentation by the DDG. Thank you. Okay. Over to you.
Yeah, thank you, Chair. My apologies. I was just checking the sequence of the items on the agenda. It suggests that we need to take the presentation on the budget vote first, and then we'll deal with the responses, follow-up to the follow-up questions. Honorable Chair, maybe you may want to guide us there.
According to the program, the two presentations talk to the presentation on the budget vote, yes, and the responses to the follow-up questions arising from the department's budget vote. Yeah.
Thank you, Honorable Chair, and then CFO will then lead with the first presentation. Thanks.
Thank you very much, DDG. Good morning, Honorable Chair, Honorable members. Honorable MEC, colleagues and members of the public. My name is Johan Straas, the CFO for the Department of Social Development. To just take you through the budget allocation that was given to us for the 22-23 financial year. I think moving to the slides will follow shortly. It's the other one. Apologies for that. We're just on a different slide here, but we'll get with that. I think just on a high level to then touch on the budget, we've had a significant budget reduction during the current financial year for 22-23. We've moved from the 6.1 billion rand that we received in the 21-22 financial year to an amount of 5.5 billion in the 22-23 financial year. This in essence comes down to a 10% reduction in the budget overall. If we look at it per the various programs, firstly Program 1, which is administration, the reduction is 2%. Program 2, social welfare services, there's been an increase of 5%. Children and families, and I think this one is affected the most because of the ECD function that was sitting underneath there. The budget was reduced by 20% in the year. Restorative services, 4% reduction in the budget. And then development and research, a 9% reduction in budget. So overall, quite significant budget cuts, I think, which puts quite a bit of pressure on us to ensure that we are still able to deliver and meet the targets that we have set ourselves within a limited budget, as well looking at the increase in inflation, increase in fuel costs, and all of that, how it impacts through the economy. So it's going to be a bit of tough years. You would see in the 23-24 financial year as well, there's a further budget reduction of 2% then. And then only in the 24-25 financial year, we are seeing an increase again of 2% in our budget allocation. I think maybe I'll just for a moment pause there so that we can just reflect on those numbers that I just spoke to. So you would see there the 5.5 billion for the 22-23 financial year, and then we're indicating the outer financial years over the MTF. The next slide then just goes into a little bit more detail to indicate, firstly, that 10% cut that I've outlined. The baseline allocation was reduced due to the ECD function shift, which I think is quite a big chunk of why the budget reduced. Centralization of the ICT budget under the Department of E-Government. So that affected all departments within the province, where that budget that was allocated there has moved to the Department of E-Gov, and then as well as fiscal reconciliation from National Treasury and Provincial Treasury. So if we then just look at the items and the various amounts over the next 3 years, firstly, you would see there 590 million rand that is relating to the ECD function shift within the current financial year, and then those amounts as well reflected over the outer years of the MTF period, 585 and 588 million. Your ICT budget shift is 7.5 million, 7.8 and 8 million that moved across over the respective 3 years. With regards to the infrastructure budget in 22-23 reduced by 12.1 million, 59 million over 23-24, and then 34 million in 24-25. And then the last line there, the cuts due to data changes, is in essence the fiscal consolidation coming from the provincial and national treasury. It was 3.6 for the 22-23 financial year, and then it will be 49 million rand for the respective outer years in that. So I think this just sums up what we are not looking forward to, but what the prospect is of our budget pressures that we will be facing within the next. You would see there overall 614 million, 702 million, and 618 million is budget cuts. So we have to find other ways. The workload remains the same, the pressures is the same, and I think because of the clients that we serve, the services that we render, which would be to the vulnerable and the poor, and the economic conditions that we are facing, we know that the need for our services would definitely just be increasing. So it's going to be a tough time for us to see how do we balance with this budget reductions. On the other side, we did then receive some additional budget allocation for specific areas to implement. Firstly, we received 76 million for public sector wage agreement. Then on the homeless program that we are having, one good thing is that Treasury has now allocated this budget for us over the MTF. It was something that every year we had to go and ask for the budget to be allocated, but I think at least there's some stability for us going forward in this program, and noting that now they've allocated a budget for us for the next 3 years, that in the next year is 87 million. Then as well for support to welfare NPOs, in the current year we received 43.7 million, 77 million in the next financial year, and then 91 million that will be in the 24-25 financial year. So as well some certainty for us with regards to the additional funds that we are receiving with regards to assisting in welfare NPOs. Then there was a reallocation of the National Development Agency budget, and then on the integrated grants, which is our conditional grants, amount of 2 million for integrated grant and incentive grant of 21.9 million. These grants is allocated on a year-to-year basis and not over the MTF. It's based on the performance of the department. The next slide then just goes into the various economic classifications. So firstly, you would see the reduction in our compensation of employees of 1%. We have then a reduction of 1% of goods and services as well in the current 22-23 financial year. I'm just going to touch on some of the big areas. So you would see our NPI budget reduced by 19%, which is quite significant. Buildings and other fixed structures was reduced by 17%, and machinery and equipment then as well a further 27%. As well then it's reflecting the overall reduction of 10% in our budget allocation. Just moving to the next slide that just then outlines under the key areas, compensation of employees. The budget includes a once-off allocation for non-pensionable allowance allocations in the 22-23 financial year. We will fill vacant posts on the structure through the COE budget allocation over the 2022 MTF. And then effective from 1 April, the department will no longer pay performance bonuses, hence the budget decrease of 1% in the 22-23 financial year. With regards to goods and services, just to outline some of our major projects that will be implemented through the goods and services budget. Firstly, dignity packs with a budget allocation of 198 million. School uniform project with a budget of 187 million. Food parcels to households, 44.4 million budget allocation. And then food parcels with regards to ART clinics, 12.3 million allocation on that budget. Next slide is then just touching on our conditional grants, which I've also just briefly touched on earlier. 21.9 on the incentive grant, and then 2 million for EPWP integrated grant. We receive these on a yearly basis, and the increases or decreases would be determined based on the department's performance and the plans that we are then handing in for the next year's budget allocation. In previous years, we also had the conditional grant around the ECD services. That conditional grant has then also shifted with the function to the Department of Education. With regards to our infrastructure budget allocation, for the 22-23 financial year, we've got 24.2 million that's been allocated with regards to new infrastructure, 44.5 million for rehabilitation, renovation and refurbishments, 9.6 for upgrades and additions. Then where the bulk is sitting, maintenance and repairs is sitting at 47.2 million, and non-infrastructure, your architectural services and IDMS services is then allocated a budget of 17.9. So overall for infrastructure, 143 million that's allocated in the 22-23 financial year, reducing in 23-24 to 99 million, with a slight increase then again in the 24-25 financial year of 108 million. These budget projections is mainly based on the readiness of projects to be implemented. So budgets is not allocated just as is, it's based on how ready we are to implement these projects. The budget for new infrastructure in 22-23 financial year includes the construction of Bantubonke ECD for 9 million, the Bakkersdal Social Integrated Facility for 10 million, Boipatong Social Integrated Facility, it's at the planning stage, so 1 million allocated there. Sharpeville ECD and Residential Facility also at planning with an allocation of 1 million. Soshanguve Inpatient Rehabilitation Center, planning stage also and then 1.7 million that was allocated for that planning. Then there was a further 7.8 million that was allocated for the overall rehabilitation of Fathers Mlwangiso Makatswa CYCC and 5 million for the rehabilitation of Walter Sisulu CYCC in the 22-23 financial year. I think that's also in line with our move of having the secure care centers within the department and taking over those services in the last financial year. Honourable Chairperson, that then brings me to the end of the presentation of the overall budget allocation. Thank you. Thank you very much.
Thank you very much, Honourable Chair. I will move ahead with the presentation of the responses, starting with the first question on human resource management. On page 307 of the estimate of provincial revenue and expenditure, the department reports that the number of interns is reduced from 350 to 329, and the APP, on the other hand, reports that the 319 will participate in the internship program. The department would have to clarify the correct number. The number of participants in the internship program on the APP is 315 and not 319, and this is correct. This is the correct number for the 2022-23 financial year. Refer to page 103 of the approved APP. The figure captured on the EPRE was also 315. The second question is on the significant decline of beneficiaries on the learnership program when compared to the previous financial year. The department must provide clarity in this regard. The response is that the indicator on the number of learners on learnership program was a composite indicator comprising of the number of learners on learnership program and the child and youth care trainees receiving training through community-based child and youth care program NQF level 4. The department took a resolution to reduce indicators to ensure a focus of the annual performance plan on the medium-term strategic framework as well as the GGT provincial priorities. This resulted to cascading of the other contributory indicators with regard to CYC receiving training through community-based care and youth care NQF level 4 to the department's approved 2022-23 operational plan. Hence the decline as this indicator attributed to the 300 learners. The committee notes the once-off allocation for the installation of CCTV cameras at Walter Sisulu Child and Youth Care and Soshanguve. The department is requested to provide the project plan for the installation of these CCTV cameras and disaggregate the allocation per center. The below is a presentation of the project plan. It's not the proposed, it's a project plan of the department on the installation of this service. The process started already on the 30th of July last year with development of specifications, review of specifications by the bid specification committee, finalization of specifications, appointment of bid probity auditors. That happened on the 30th of November 2021. In this year, we went ahead with a review of specifications by the probity auditors, finalization of specs and probity audit report based on guidance from National Treasury, and we will be dealing with the advert around the 15th of July 2022, as well as a listing of bids by Gauteng Provincial Treasury around the first and second week of August, and collection and evaluation of bids between the period 16 August and 16 September 2022, and the tenders will be awarded in October. The above-mentioned processes will be finalized after receiving further guidelines from National Treasury on implementation of the preferential procurement regulations. It is anticipated that the tender will be awarded in the third quarter of the financial year. The estimated budget, Walter Sisulu is 4.2 million and Soshanguve is 4.2 million. Totaling 8.5 million. I must indicate here, Honorable Chair, that these changes that we are effecting at Walter Sisulu and Soshanguve are as a result of the decision to take over services that were previously rendered by the Mohali Youth Development Center, previously known as SASSA, which is located in West Rand. So we have taken the responsibility, and all the children that were previously accommodated in that facility are now accommodated in state-run facilities and the two secure care centers, which is Walter Sisulu and Soshanguve. Hence, we are improving our services and the security, because there now we are dealing with children, not just in conflict with the law, but also sentenced children. With regard to services to persons with disability, the committee is concerned with the department's targeting on protective workshops, noting the objective of this output. In their response to this concern, the department should also indicate the reason for increasing the target by additional 2 beneficiaries compared to previous financial year. The response is that the setting of targets is aligned to the number of beneficiaries funded as per the SLA signed with NPOs. The increase in the target is thus informed by this process. Protective workshops was one of the services that were adversely affected by the COVID-19 pandemic, and this has further influenced the attendance of persons with disabilities. All protective workshops have since reopened in 2022-23 financial year, and a workshop was held with the sector in April 2022 regarding the standard operating procedures of protective workshops, which included increasing participation of beneficiaries. The committee further is concerned that the same department which reported to the committee that it does not keep database of different types of disabilities is suddenly concerned that it does not have the capacity to deal with different types of disabilities. In addition to the response on the concern, the department should also highlight how is it able to render holistic services to persons with disabilities without such a database. The response, honorable members, is that the department funds NPOs that render services to all types of disabilities, and the database for NPOs that provide services to various types of disabilities is updated and maintained. This includes funding of variety of services to persons with physical disability. This includes, but not limited to, muscular dystrophy, multiple sclerosis, spinal cord injuries, cerebral palsy, and others, blind, deaf, epilepsy, psychosocial, albinism, autism, intellectual disability, and Down syndrome. The details of these individuals and the type of disability are included in the claim form submitted by the NPOs to the Department of Social Development for monitoring and evaluation processes. This information is however not collated into a database. These individuals further receive services from other GPG departments, namely Department of Health, SASSA, Community Safety, as well as the Department of Education. The committee further states that the department has been rendering services to persons with disability for more than 20 financial periods. How is it that to date there is inadequate programs for parents of children with disability? Is such not a failure of the department in meeting the objectives set out in the National Development Plan on improving lives of PWDs? The response of the department is that services to parents to children with disabilities are provided by social workers through funded NPOs. Capacity building was furthermore provided by the department on the South African Sign Language for parents of deaf children and Makaton training for parents of children with autism during the previous financial years. There is still, however, a need to reach more parents, including those with children of different types of disabilities, hence the cited challenge and inadequate programs. This is work in progress, honorable members, and we will continuously provide a progress report as we continue to expand on our training programs targeting different types of disabilities. But as it was also indicated, some of the disabilities are attended to by other departments, such as Department of Health, which also have got their own clinically orientated training programs to assist parents to deal with children with disabilities. The department is requested to unpack how the allocation of services to persons with disability will be spent, noting that the annual targets do not show an increase when compared to the previous financial year. The funding allocation of the program has increased by a small margin, and these funds will be allocated to accommodate the 3% increase through the from the 2021-22 financial year. The department uses per capita model to fund PWDs, which is based on the number of beneficiaries each organization has. Subsidy allocation is to be utilized according to the following budget items: provision for secure and safe facility, governance and operational requirements, provision of safe living environment, program implementation such as skills development for people with disabilities, provision and facilitation of access to primary care services, nutritional requirements, as well as maintenance of a healthy living environment. I must indicate, Honorable Chair, that the minimal or the marginal increase is actually applied across the board because of the limitation of the budget which the department has received. So it's not only limited to persons with disabilities. But for the current financial year, this program has been allocated over 140 million rands to implement these listed programs. With regard to HIV and AIDS, the department to share information on the funding plan for home community-based care food relief program and how such funds are allocated to NPOs and the number of HCBCs to render these programs. In fact, when it comes to HIV and AIDS, this program is not defined within the context of food relief. It is actually defined within the context of social protection package, commonly known as psychosocial support for persons with disabilities, because food is part of a package of service that HCBCs are rendering, particularly targeting people who are on treatment. So the department funds HCBC organizations towards this program, and the said funding entails the provision of daily meals as well as food. The drop-in center provide prepared meals, while HCBC organizations provide, amongst others, food parcels as part of the psychosocial support package. The funding plan for the above-mentioned models of care is as follows. For the food, it is costed at 370 per household, and for the drop-in centers, it's 185 per beneficiary per month. With regard to care and protection to children, the committee states that the target of 206 is noted. However, can the department provide a detailed information on the number of children that are identified and or eligible for reunification? The response of the department is that children are moved from family care due to social issues, which places them at risk. Hence, the court make a determination to place them in alternative care as per the provisions of the Children's Act. The department remains committed to ensuring that children are reunited with families and placed in family care as per the objectives of the Act. But once children are in alternative care, social workers begin with reunification processes where the focus is on reunification of children with their families. However, in certain cases, this reunification becomes difficult due to the severity of the social challenges which the children would have experienced in their own families. For example, abuse and such extreme cases. Therefore, all children who are eligible for reunification will be reunified with their families, but this depends on the social worker's assessment of the status of their families as well as the commitment of the child and the family. So the numbers are not static. They depend on individual cases as and when social workers conduct their own assessment to determine the prospect of success in the reunification of the child to the family. What is the current social worker ratio on foster care cases, and how many supervisors are responsible for foster care, and what is the ideal setup on both ratio and supervision? The case load varies according to the regions and the number of children placed in foster care. The ratio currently ranges from 1:60 to 1:110. The total number of supervisors, including those in the employment of child protection organizations, is 175. It should be stated that social work supervisors are responsible for child protection, including foster care. The ideal ratio for caseload per social worker is 1:80, and the ideal ratio for supervisor to subordinate ranges from 1:3, 1:10, and 1:30. The ratio of social workers to a supervisor or supervisor to social workers is actually dictated to in terms of the supervision framework, the national supervision framework. So the ratio depends on the responsibilities of the supervisor. I must indicate, Chairperson, that the department has really done well to reverse the backlog in as far as supervision capacity in the department is concerned. On average, at the moment, and generally, including in other areas outside foster care, our average supervision capacity is around 1:6. Which is well within the provisions of the supervision framework. So community-based care services for children. An observation is made that the number of children to be reached through community-based prevention and early intervention programs remains the same at 19,400. What informed this target, considering the recent challenges brought by COVID, which may have necessitated for more children to be budgeted for? The decision to retain the target is due to the department's aim to enhance the provision of comprehensive services to children accessing community-based prevention and early intervention programs. This includes the following programs: psychosocial support, HIV and AIDS, educational support, health promotion, health care and protection, economic strengthening, and as well as food nutrition. The department further aims to ensure and enhance beneficiaries' access safe parks, a critical element of service delivery in the context of community-based prevention and early intervention programs. It was therefore deemed necessary to retain the previous financial year's budget while enhancing service delivery in the current financial year. I must also indicate, honorable members, that...
Sorry, DDG, I just want to interrupt. I'm not sure if the people at the back can hear you. Can I just get confirmation if you can hear the DDG's presentation? Those of you who are sitting at the back, can you hear? Okay, great.
Oh, okay. Thank you, Honorable Chair. Yeah, so the point I was making generally, Honorable Chair, is that the CFO was presenting on the budget. We do not receive, a lot of increase in as far as the budget is concerned from the provincial fiscus, and at times we have to deal with a little bit that we have to make sure that we really provide the best of the service we can under the limited resources that we have. How many NPOs are rendering this service? It's 67 NPOs. Crime prevention and support. The committee notes with concern the weakness and the threats raised by the department on the implementation of the crime prevention related programs, which suggest that achievement of the outcome indicators has not been possible since these weaknesses and threats have previously been reported by the department prior to the current government term. The department is requested to respond to these observations and demonstrate solutions. With regard to the first weakness on non-compliance with provisions of minimum norms and standards for diversion services, the department has appointed a quality assurance panel which will be responsible for monitoring and provision of mentoring services for all service providers to ensure compliance with provisions of minimum norms and standards for diversion services. With regard to diversion programs which does not recognize children at risk identified by schools, but rather on court cases. Diversion services by its nature is for those children who are already in the criminal justice system. It is meant to ensure that these children do not get deeper into the system through implementation of diversion services. The department is providing early intervention and prevention services for children who are still at risk, who have not come into contact with the courts. I must also indicate here, Chairperson, that although they are not implementing diversion programs, but we do have social workers who are deployed in high-risk school focusing on supporting children who may be prone to the risk of committing a crime, either informed by substances or other circumstances. So as much as the diversion programs legislatively are directed at children who are already in the justice system, there are other interventions which are intended to prevent children from actually entering the justice system altogether. Minimal contact with diverted children. The department have started with contact sessions for diversions since the end of the lockdown. There are systems in place to ensure safety of children against the virus. The high level of reoffenders due to lack of proper monitoring and blanket approach attached to all cases by service providers. The quality assurance panel, which has been appointed, and the developmental quality assurance and case audits conducted in the regions and NPO sector have ensured that children are referred to programs that match their level of risk. NPOs, limited resources for automation and electronic implementation of program. The National Department of Social Development developed accreditation of diversion system which assist NPOs to apply for accreditation of their sites and programs in line with the provisions of the policy framework on accreditation of services for diversion. Actual implementation of diversion programs is meant for behavior change. And for this reason, programs are implemented face-to-face to allow interaction between the facilitator and the beneficiary. On substance abuse, the committee noted that the below statement bears reference and more clarity is requested from the department. And also, there is a need for the department to clarify the impact of this service delivery and department achieving its intended outcome. Unavailability of health officials to assist with the assessment of compliance of treatment facilities. In terms of the Substance Abuse Act, or what is commonly known as the Prevention of and Treatment of Substance Abuse Act, the treatment centers provide detox services to service users and ensure that such treatment complies with the National Health Act, which is the mandate of the Department of Health. So once the facility has been registered, the Department of Health must form part of the monitoring team to ensure compliance to legislation, policies, norms, and standards. These are often there are often delays encountered from Department of Health officials to conduct assessment and submit reports that make the relevant recommendations for finalization of registration and re-registration processes. And obviously these delays impact negatively in as far as concluding registration processes are concerned within the prescribed timelines. But we remain committed to engaging with the Department of Health in instances where we are having these delays, Honorable Chair, so that we can resolve these challenges. On poverty alleviation and sustainable livelihood, the question by the committee is what model is utilized by the department to ensure that welfare to work program is accessed by all communities in need of it. The response is that the department shares information utilizing various community development initiatives and different mediums to disseminate information in all regions, prioritizing the poorest wards to ensure that the program is accessed by all communities in need within the available resources. The program is implemented through a partnership with NPOs, and the information is further cascaded to communities through community outreach programs, community and household profiling, where beneficiaries that are identified from household profiling are referred into these programs and to participate in the program. But also we have got development centers that's referral desk. And the department and the NPOs participate in advertisements on various social media platforms, including the TSEPO 1 billion information sharing events, which are also used. How is the program? The committee is asking. How is the program costed, and what is the allocation for the year under review compared to the previous financial year? The Welfare to Work program was allocated 30 million in 2021-22, and the amount has increased to 32 million in 2022-23 financial year. The costing is based on the number of beneficiaries to be reached for that particular year and the type of program to be undertaken, such as social relief, skills development, technical skills, and many others. The department is requested to provide a breakdown on how the 575 co-ops will be linked to economic activities and the nature of these. Disaggregate this information by highlighting the number of cooperatives responsible for cleaning, gardening, etc., and those that will be on the school uniform and dignity packs program. The response from the department is that 210 cooperatives will be awarded short-term contracts, which include cleaning, gardening, and laundry services in departmental facilities. 9 institutions have short-term contracts awarded to cooperatives rendering laundry services, and 5 regional offices have short-term contracts for cleaning services awarded to cooperatives rendering cleaning services. Gardening services is rendered at 13 institutions and 5 regional offices, and the short-term contracts for gardening services will be awarded to cooperatives. The appointment of cooperatives is regionalized, and cooperatives are appointed on rotational basis using the request for quotations process below the threshold of 1 million. Furthermore, 9 cooperatives will be part of the Dignity Packs project, of which 4 is for the tissue paper and 5 for packaging. The balance of the cooperatives will be participating in the school uniform project once the SCM processes are finalized, as well as from agricultural project once establishment of cooperatives are concluded. The committee requests the department to detail a plan on how the school uniform and the dignity plan program will be implemented in the year under review and the budget allocated for each. The response is that the school uniform project will be implemented through appointment of cooperatives and service providers using the SCA. Developed the specifications, and it was planned that the project will be advertised in March 2022. However, the specs development process could not be finalized due to the Constitutional Court judgment on the implementation of Preferential Procurement Regulation 2017. The BSc concluded that the specification will be finalized after receiving guidance from National Treasury. Based on the guidance from National Treasury, it is anticipated that projects will be advertised and awarded in the second quarter of the current financial year. The total budget allocated for school uniform is for 2022-23 financial year is 187 million. We continue to engage with Treasury to maximize the benefit of cooperatives in as far as the 187 million is concerned. With dignity packs, the department advertised a tender to supply the dignity packs in February 2022, and the tender was supposed to close on the 18th of March. The tender was put on hold due to the Constitutional Court judgment, as I indicated earlier. The department will cancel or re-advertise the tender based on the guidance to be issued by National Treasury on implementation of preferential procurement regulations. To mitigate against the risk of non-delivery, the department submitted a request to deviate from procurement process and appoint service providers on quotation basis above the threshold of 1 million to Gauteng Provincial Treasury in March 2022. Gauteng Provincial Treasury considered the application, and additional information was requested from the department, and the required information was submitted the same month of March. Gauteng Provincial Treasury granted the department approval to deviate on the 31st of March, and the approval was granted with the condition that we should approach National Treasury to request for an exemption. The request for exemption was submitted on the 14th of April, and National Treasury granted the department exemption on 28 April 2022. The department will start with the process, and it is anticipated that the delivery of dignity packs will commence sometime in June, and the budget allocated for this project is 198 million rands for the current financial year. The department will provide more light on significant budget change on poverty alleviation and sustainable livelihood. The department received additional budget to support the welfare NPOs over the MTF, and to also provide for poverty alleviation as well as sustainable livelihood sub-program NPI baseline was increased over the MTF budget. The budget increases from 32 million in 2022-23 to 50 million in 2023-24 and 53 million in 2024-25 financial year. I must indicate, Honorable Chair, that we have taken a decision to intensify the implementation of the anti-poverty strategy, particularly within the context of the poverty war room that has been established by the Office of the Premier, which is also led by our MEC here. Our point of emphasis is on introducing new innovations on sustainable, focusing mainly on skills development, entrepreneurship development, as well as job creation and job placement. So these increases are in line with our development objectives. Example, Welfare to Work program has got its target on young people, for example. You may also have a similar youth targets within programs such as your expanded public works program and other services in the department. Hence the increase in the target without necessarily an increase in the youth budget. The budget is sourced from other programs which are implementing youth programs. Thank you very much, Honorable Chair.
Thank you. Thank you very much, DDG Kabasia. Honorable members, there are the responses to the analysis that you undertook in the meeting that we held on the 6th of May, where we had a virtual meeting where we really analyzed the budget vote 6. And I think the responses have come forth. So I'm not sure if you are happy with the responses, because I think you only got sight of the responses this morning. So I will give you an opportunity really to interrogate the responses further if you're not happy with them, and also to indicate if you are satisfied with the responses that the department has provided, but then to allow you to pose follow-up questions if you do have follow-up questions that you want to raise with the department, so that we are on the same page on the matters that have been raised. So I will open for further clarity-seeking questions from members of the Portfolio Committee before I open to our stakeholders. Let me get an indication from members if you want to further probe. Honorable members, are we happy? Okay, Honorable? Are you okay? Okay. Yeah, I just have, I think, maybe one question on the issue of the increase, the 77 million increase to the NPOs. I just want clarity. Could that be, because of the number of NPOs that have increased, or have you increased the actual amount that you give to specific NPOs? If you could just clarify the thinking behind that increase of 77 million, and also maybe provide a breakdown on those NPOs that would actually be allocated with the increase, and for what purpose, just for us to have comfort as to where the money goes. They say you must follow the money, so we're following the money. CFO, I'm sure you understand what I'm saying. And yeah, I think you covered the issue of the CCTV issue properly, DDG, because we also had raised an issue around the issue of the CCTV cameras at the Soshanguve facility and all that. And then, my eyes are failing me today, my other eyes. I can't see my own handwriting. Yeah. And then on the issue of the people with disabilities, your stakeholders, I'm not sure to what extent are the people with albinism being covered. In your other presentation, I think that there is mention to the people with disabilities, but that specific area of people living with albinism, we would need to further interrogate it and maybe have a further conversation around that in terms of what you are doing as a department to engage that sector specifically. Yeah, I think from my side, I would just request those few clarities, and then I'll open to members of the public to further engage. Thank you very much.
Thank you very much, Chairperson. Chairperson, just to the 77 million is for 23-24 financial year. So in our current 22-23 financial year, we received 43 million with regards to NPOs. The next year would be 77, and then going up to 91. This is in essence an allocation that came from Treasury after going through the Premier's Budget Council. I think just taking into consideration the overall budget cuts and the need for additional funding in this area, they then made this allocation to us. What we've done in the department, and it goes back to the second last response that we indicated in the questions, where mainly we've indicated of the 43 million that was allocated, 32 million of this in the 22-23 financial year is mainly going towards poverty alleviation and sustainable livelihood NPOs, which is doing skills development and all of those programs. I think we can, as a subsequent, provide you with the detailed list around that. I think the remaining balance is then spread across the other programs with regards to filling in budget pressure gaps that we had. And the same approach, if you would see for 23-24, we're allocating 50.8 million then for poverty alleviation and sustainable livelihood. I think that is in line with the implementation of the anti-poverty strategy as well that we are strongly driving. So we then best found it to push that money into those areas where we can have a high impact with regards to poverty alleviation and sustainable livelihoods in our communities. I think, Chair, I hope that suffices it because the rest has been split over the other programs, the remaining balances that is left there. And it would have gone to older persons or disabilities through the various ones, but it would be on an overall program level, not necessarily specifically towards individual NPOs. I think, Chair, just to add maybe on the albinism, we can go into a little bit more detail at a later stage on that, but I think just as one of our key aspects, as part of our dignity packs, there's specific focus with regards to dignity packs, which is going for people with albinism, where we then include hats that is made by the cooperatives. We include sunscreen, lip balm, and all of those as well as one of our specific services that we are rendering in assisting people with albinism, where they also then on a monthly basis receive these dignity packs. And I think through some of our other engagements as well, we've also then included where we could with people with albinism in the food distribution, food parcels as well. So I know there's been engagements with the albinism community with regards to seeing how we can strengthen as well the services that we are rendering to them in the various communities. Thank you very much, Chair.
Maybe something that slipped my mind is the issue around the training specifically for social workers, because I heard there's still a challenge on the Form 30 issue, with regard to foster care. So if you could just maybe elaborate if there is going to be spending on that specific training for social workers so that they are able to properly deal with these issues of the Form 80, because you remember previously you had presented that some of them were not well trained. In that seminar that we had, we picked up that some of them were not properly trained in terms of filling in of the Form 30, and there was a recommendation that was made in that seminar for you to actually engage the Department of Justice in terms of training of these social workers so that they can properly be able to do the proper administration so that there are no further delays in terms of placing of these children. Yes.
Ms. Mukondo will respond to that question. Ms. Mukondo is the Chief Director responsible for social welfare services in the department. Thanks.
Thank you. Over to you, ma'am.
Oh, yes, thank you. Good day, Honorable Chair, members of the committee, Honorable MEC, HOD, DDGs, and all. With regards to the Form 30s, Honorable Chair, the department has since implemented, the processing of the Form 30s. We have social workers who have undergone training. All the regional offices and the designated child protection organizations have been trained on how to access the system and also print the outcomes, of the Form 30. So that assisted the department a lot in dealing with the foster care backlog. So we're no longer having challenges with regards to the implementation of Section 125 of the Children's Act that says that all the Form 30s must be completed to check if a person is not appearing on Part B of the register. So that challenge has been dealt off with, both at provincial office. There are officials that are trained, provincial office, at all our regional offices, including the designated child protection organizations that are assisting us to do work with regards to, foster care and child protection services. Thank you.
Okay, thank you. Thank you very much. Do you want to say something, DDG?
No, Honorable Chair, I think we're fine.
Oh, okay. Okay, thank you. Thank you so much, MEC and the team for the responses. And honorable members, thank you very much. I will now open for our guests, our stakeholders to engage the presentation. And I will take hands. If you raise your hand, you just introduce yourself and the organization that you represent, and then you make your submission. Can I note hands? I see one on my far right. Only one hand so far. And I check number 2 here in front of me. Any other hands? 3, 4. Yeah, I've noted 4 hands, okay? Okay, Pastor, you can take the first bite.
Thank you, Madam Chair. Members of the Portfolio Committee, Department reps, I've just 5 questions or points to raise. The first one is that over the years, the department has targeted between 72 up to 75 old age homes, and at one stage you plan to have 80 old age homes, but you've never reached 80 yet. We've got over 243 old age homes in the province. How are we going to reach that? Secondly, Mr. Kabasia spoke about that there are a lot of beneficiaries in the protective workshops. My problem and concern is that whilst there might be a lot of beneficiaries, the Ames workshop in Kensington is being closed. That means we're now going to be pushing beneficiaries into fewer programs. How effective will that be? The third point, I agree that disability is a very important thing, and we need to make sure that they are cared for, but have we thought about the extra expense when people who have got disabilities need to go into frail care centres, and that comes under the Older Persons Act? How do we handle that? A very important concern, Madam Chair, is the fact that there is still a problem between the Department of Health and the Department of Social Development about the training of caregivers. And as a welfare forum, I keep getting questions as to when are we going to get training in the older person sector. And finally, we are aware of the fact that the Older Persons Amendment Bill has gone into the National Assembly, and the question comes that there has to be norms and standards and regulations. Do you or does the department have any idea as to when this will be finalized so that we can actually prepare and plan to deal with the Amendment Act? Thank you.
Thank you, Pastor Les. Number 2. Yeah, the gentleman there.
Sawubona phambili. Sanibona nonke. Lo nome apha nguLukhanya Mnyamana. Ngiphuma eIvory Region A. Ethi Lukhanya Mnyamana from Youth Explosion. Ngiyabonga ngelithuba ngelitholile namhlanje. Ngibonga ngokuthi sizile. Ngibonge ngemessage esiyitholayo lapha kini. Iyangikhuthaza. I-youth explosion i-NPO sibuyisa ithemba kubantu abahluphekile. Masibuyisa ithemba. Sine problem enkulu. Qhoma sesiza lana kukhulunywa kahle. Siyayizwa i-message yahambisana nathi as ama-NPO. Sine problem kubantwana abana age of 16 years okuya phezulu. Kuma activities esihlangana nabo kubo bona laba bantu bane disability. Sithola problem ekhlالين. Ama social worker is truly i-message angathi ayifiki kuwo lawa sekhlالين because of one reason. Abafundisekanga kubantwana bane disability masiya basitshela ukuthi basebenza ngabantwana bana 6 years to 12 years. So from 16 years upwards to 19 asazi ukuthi siye kuphi. So kwi budget le ifikile thina ama NPO siyazama ukuthi sincedise ngosingenanto siyazama ukuncedisa abantwana basekhlالين but ama social worker yasfail abafiki. Siyacela sicela isandla kakhulu kuni bantu bangaphambili i-message ikwazi ukufika kubo bakwazi ukusamkela ngendlela right because thina abantu bama NPO sithi masingena ngazi noma singabantu ababi abasithathi serious. Siyazama ukcomplain about abasithathi serious so sicela isandla kuyo lo ndawo. Ngiyabonga ngebudget esizwe. Thank you.
Thank you very much for the question. Number 3.
Thank you, Chair. Thank you, MEC. My name. My name is Sifiso. I'm from Ekurhuleni municipality. My question through you, Chair, is on the issue of the youth. I just want the department to explain to us which specific skills they are providing on the issue of skills development. So the specifics, what are you doing? And then because now it's a provincial level, from the regional level, where should we go? To the ward level, where should you go in terms of skills development? At a provincial level, I'm asking where should you go from regional directly to the ward level? Because it seems like we are in a periphery at the ward level because we don't know anything, we don't have information. Then you spoke about the issue of social development which are deployed at Skolweni to deal with the issues substance abuse. We don't see those people. Social worker that we said they are deployed at Skolweni. We don't see them. So can you please assist us to say from the regional level, where should you go? What level, where should you go to tackle these of young people? And then what skills exactly do you provide as a social development? Thank you.
Okay, which is number 4.
Dumela magolo. Ke le dumedisa ba botlhe. Nna ke Olga Tshukudu ke tlhaga ko Kagiso Education of Hope Africa. Rona re bereka ka the people who live with HIV and AIDS. Di bana ba di orphan. And then thuso e ke batlang ke kopa gore le re thuse because of ga rena nix. And then re apela bana ra ba apela Monday, Wednesday and Friday. Ke a leboga. Today ke ithutile something. Ke a leboga bagolo.
Thank you, Mayor Olga. Yeah, number 4. Mayor Olga, unosa emisa letsoho, but thanks for the input. Ntate Komorao was number 4. Thank you.
Thanks, Chair. Re qale ka ho dumedisa ntlo kaofela. No, my tsaka di two fela. First is clarity. I need just clarity around the issue of PWD. People with disability. I've heard the DTG said they don't have a clear data. They rely their data on the NGOs that are getting funds. What about those ones that are not getting funds from their sites, from their department? And secondly, it's around the criteria of choosing those NGOs that are dealing with PWDs. Because if you go to our community, you'll see a disaster in that sector of people with disability. Are you including sectors that are dealing with disability when you do your criteria in terms of choosing NGOs that are dealing with PWDs? And secondly, is around the issue of ownership. I think as department, we must take the ownership around the issue of food parcels and foster care. If you go around our communities, you can see a serious disaster with those children who are getting foster grants. Those monies are not working for them. They are working for those other people who are applied for foster grants to buy wig and nails and everything. But if as department we can take ownership of those programs, because those are very sensitive programs, I think as department we must take that ownership and own that programs. Thank you.
Okay, thank you, thank you. Let's check if there are any questions on the online platform. On the online platform, we've taken hands in the house. So on the virtual platform, those that are connected virtually, can I get an indication from the one who's controlling the gadget? Just to check if there are any hands there, because I have not connected, so I can't see if there are any questions. Any indication? No. Okay, Sipo, can you confirm? Is there one? Kima? Sorry? Patrick. Yes, Patrick, you can ask your question. Over to you, Patrick. Dr. Patrick.
Good morning, colleagues. There is a few questions that I want to ask, but firstly, let me start by thanking you guys to give us this opportunity. My name is Patrick Mabilane from Ubuntu Community Empowerment Center, Ekurhuleni East in Gelexdal. So we are operating from the colored area. I've got questions that I want to ask from you, because now we are speaking about the increase that the budget was given to NPOs. So I would like to find out if there is any increase in terms of remuneration of staff, and if there is, how much percentage is given to those NPOs are funded by DSD. And secondly, we have been treated unfairly by our officials. They don't treat us like we are their stakeholders. So I want to find out, in terms of monitoring, there is any standard way of monitoring the NPOs, or people or NPOs are being treated differently. Last but not least, as an NPO that we are dealing with skills development, we also have the program of CNDC. So I want to find out if there is anything that the department can able to assist all the NPOs that got CNDC to provide them with transport in terms of procurement, because we are struggling too much in terms of procuring our food to feed our beneficiaries. So may please the officials come to our rescue. Thank you.
Thank you, Dr. Patrick. Any other hand on the virtual platform, Sipo? None. Okay. Thank you. Thank you very much, our partners, for all the questions and the clarity-seeking questions. I will now give the department an opportunity to respond to all the questions that have been put forward to them. So I don't know who's going to take the first bite, but before you do, maybe Pastor Les, let me clarify that issue of the older persons bill. It has informally been referred by the Portfolio Committee, the National Portfolio Committee. But as soon as we followed the proper processes, the legislature processes, the bill will arrive at the committee and it will be processed accordingly. And when we interrogate it, you stakeholders for older persons will be invited to that public engagement session. And then you will have an opportunity to really interrogate that pastor. Yeah, so I'll hand over to the department to respond.
Thank you very much, Honorable Chair. I will respond, and I think where I may have missed, the team will come on board and assist. Chair, maybe let me start first by indicating that on funding of residential facilities for older persons, firstly, we fund based on the available budget that we have as a department. Secondly, we fund on the basis of qualification and compliance in as far as the legislative framework is concerned. So it has never been part of our plan to fund all the residential facilities for older persons. There are those that operate privately and they are able to, to survive based on the money being paid to them by beneficiaries. So our focus in the main is to try and focus on those that mainly accommodates people who may not be able to afford the kind of fees that are paid, for example, in private facilities. So our target, Honorable Chair, is informed by the allocated budget that we have. And that what dictates the numbers in as far as that is concerned. With regard to the protective workshop that is being closed, I would request that we engage with Pastor Sanabria, maybe on the sideline, Chair, so that we clarify the issues around the Kensington protective workshop he is referring to. But at any given point, when a facility is closed, whether disability, older persons, we always put in place a process to make sure that beneficiaries don't get disadvantaged, so that we do not just throw people into the streets, but we work with the NPO to make sure that people can be linked. But we'll engage with him outside the meeting, Honorable Chair, so that we get the details of the point that he's raising. With regard to frail care, we do have a frail care facility in Zanelembeki, Honorable Chair. Zanelembeki is actually, it's not actually an old age home, it's a frail care facility that is able to deal with old age and the frailness that could come as a result of either aging or any form of physical disability. But we also do fund other facilities run by NPOs to deal with this kind of a service. So far, Chair, we haven't really had a situation where we had people that were identified for placement and they were never placed. That would require this kind of a service. With regard to training of caregivers, Chair, we continue to implement capacity building across all our programs, including for older persons as a program. So I'm not sure if there is a specific group which the pastor may have an issue with, and in that case, we'll be willing to consider his views so that we can see then how do we respond to that. I will also want to get more details from my colleague from Youth Explosion around the disability between 16 and 19. I am certain that he will have maybe a list or the names of affected persons which can then be made available to the department and will assist in guiding in terms of how that can be handled moving forward. There was a question asked by Tepiso on the kind of skills that we're talking about. Chair, we do have a lot of skills that we do through our beauty hub that deals with I don't know, to do with Beauty Hub Academy, to do with nails and all these things that make ladies look beautiful. And we are also introducing other skills programs, including with making, cosmetic manufacturing, chemical, peel and facial, electrical, all these complicated terms, Chair. But we have got quite a broad range of skills development programs, including ICT. In our centers of excellence, we go to the extent of including your bricklaying, your carpentry, electrical skills, and many other things that young people are able to utilize to survive in the workspace. We are as part of our priorities in the current year, Honorable Chair, we will also even be going into the business of food delivery. As you know, that each time you call an Uber Eats, it's very rare that you find Tabiso riding a scooter delivering food to your household. And we are also engaging quite aggressively to make sure that young people who have got interest in such businesses can actually begin to access that, so that we do not have that market being dominated not by young people from our communities. I think I'll leave it there, Honorable Chair. Yes, and then still on Tshepiso MEC, I think the issue of access to information, we have got regional offices and service points of social development in Ekurhuleni. And in each service point and the region, you've got welfare people, you've got Program 5, which is your community development of officials there. They are always there to provide the relevant information in as far as all these programs are concerned. And you also mentioned that I spoke about social workers in schools and that you don't know. We will provide, if you go into the website of the department, you'll get information around school social work. But even at the regional office, we've got social workers that are purely appointed to render services in schools. And you can be able to get that information there. Also, Olga, I'm not sure if your NPO is registered and whether you have applied for funding. But, Honorable Chair, I want to indicate that because of the budget limitations for the current financial year, we chose not to fund a lot of new NPOs unless those NPOs speaks to, or the services speak to the GGT priorities for the remaining 2 years, our deliverology agenda. And when I talk about deliverology, it also refers to critical priority programs such as your gender-based violence. We are expanding the service in police stations that did not have access to this kind of a service and so forth. So we have prioritized those, including sustainable livelihood and poverty alleviation. And also part of the increments that we received, we allocated it to increment of salaries for social workers and other employees in the NPOs, but also to make sure that we do the annual increases to comply with the ministerial determination in as far as expanded public works program beneficiaries are concerned. So those were the priorities that we focused on. Thank you very much, Honorable Chair. Yes. I think Patrick spoke about the increase for staff, which I've touched on now, unfair treatment by DSD staff. I think, Chair, on this one, I would engage with him after the session just to understand what complaints is he having around the treatment by staff of social development, so that we can work on that. But I must indicate, if it's about M&E, Chair, it's always a fine line. We encourage our officials to treat NPOs and NPO officials with the greatest of respect, but remain firm in making sure that issues of compliance are not compromised. So there's always been complaints sometimes from our own officials, that NPOs don't want to let them in. They close, they lock the gates, they set dogs on officials. Sometimes NPOs do complain. But if you complain about our staff, we have got no reason not to take your complaint serious and make sure that there's redress in as far as the complaint is concerned. Thank you, Honorable Chair.
I just need to make additions, Chair. If you allow it, yeah, I just want to make additions to, starting with Patrick. Patrick, you also raised an issue around transport. I don't know if you're aware of the fact that the department has allocated more than 200 vehicles to different NGOs in the previous financial year, was it? Yes. The previous financial year. But Patrick, there are requirements to regulations. We don't just give cars and then allow people to turn them into taxis or whatever. They must be used for the specific purpose that they were allocated for. And that always it's included in the SLA that we sign with NGOs. We just want to make a plea to NGOs that, you know, we are aware of the fact that the work that we do as a department, we cannot do without LONA, the NPOs. But unfortunately, sometimes we do have problems with NPOs by Lenghormona, but decide that we ready lo differently. So Patrick, nerekopa hore, yanaka DDG abuletsi here. If you have problems with the NGO that you're working at, raise it with us. You can send an email either to me or to the DDG or even to the office of the HOD so that we assist you to address the matter. It is not in our interest to just close down NPOs and NGOs. You are our partners. So we strive at all given times to help you to resolve your problems, but it's also important that you understand that our intervention is done within the ambit of the law. So, so, and then LONA as an NPO together with your board members, you must find each other and remember at all times that the reasons why you registered as an NPO before was to give a service. So hello lose a focus amongst yourselves, whatever little amount of money that we provide to help us to provide a service to the communities. So the reason why you started what you are doing in the first place. There was a gentleman who said something about ownership on food parcels and foster care, and that your concern makes a lot of. You want to respond to it, HOD? Yeah, okay. Oh, sorry, it's not my meeting. Get the permission.
HOD.
Thank you very much. I want to respond to the issue of ownership. Let me start with foster care. We are well aware as a country that there have been challenges around foster care. Gauteng, I think another province that has got dedicated social workers to foster care is Western Cape. And we are really commended by National in doing that. However, we acknowledge that there can be gaps within the system where there is not necessarily proper monitoring. But periodically, we do check how are the children being taken care of. And also we encourage community members, where you know that there's a foster child that is not well taken care of, please bring that to our attention. On the issue of food parcels, I want to highlight the fact that sometimes people don't know where the food parcels are coming from, and they assume they are from the department. We have various organizations that are assisting in communities with regard to giving humanitarian assistance. So we want to highlight and make a plea to community members that if they observe something untowards, especially with cars, our cars are branded. The departmental cars that deliver food parcels are branded. So if you observe something that is out of order, please tell us. However, our plan as a province is that all food delivery should somehow be well coordinated, because we have also picked up challenges around people who are double dipping or triple dipping. So if you also observe a particular organization that is doing things that are not proper, you must tell us, because
people in communities are really fighting and only to find, we only discover later when we go there and make some kind of an investigation that it was not necessarily food delivered by Department of Social Development. But we want you to bring that to our attention because we've been requested by our Honorable Premier that we need to try and coordinate food distribution processes in the province. Thank you.
Thank you, HOD. I thought you were not going to speak. That's why I didn't note you. And I noted the MEC. So it is just proper that the MEC closes, wrap up on the questions, on the responses.
No, it's fine. I think that was the last one that you took care of. Thanks, Chair. I think we have responded to all the questions. I was just checking my notes. We have. Thank you very much for the opportunity, Chair.
Okay, thank you. Thank you very much. Are we all happy? Happy? Thank you. Thank you very much. Let's then proceed to item number 9 on the agenda, the presentation of the department's APP for the 2022-2023 financial year, and noting that some of the questions that we have asked from the previous presentation would have been included in your APPs, so you would have touched on those responses through your answers. Ne? You would have touched on some of the questions through your answers on the previous presentation. So I would just give you an opportunity just to make a high-level presentation for the purposes of the stakeholders that are here. And maybe just to say before we proceed on the previous item, the issue of the youth. It's one thing for the department to have all these grand programs, but the youth don't know about them. I think we really need to intensify our reach through the marketing, our reach to the youth formations so that they get information. But also for them to be proactive, to seek information, use the internet. Information is there, readily available to you. You also need to know where your regional offices are when you have interest in these matters, so that you are able to interact directly with warm bodies, with persons, without talking to them over the phone, because it's easy for them to dismiss you over the phone rather than visiting them, making an appointment, going to the office, they engage you properly, you have proper information, so that when you go to your organizations, you are able to disseminate information, to the relevant people, so that they know how to access these opportunities. Because we can't be talking about opportunities when they are there for you, but you can't access them. So I think it depends on both sides to really make it work for all of us. Thank you very much. You can proceed, DDG, or whoever is going to make a MEC.
I'm not sure if I'm out of order, you'll correct me. But I think what you said is correct, that the young people also need to be proactive. But I also think it's important that, we explain to the community that most of the young people that we work with in the programs that he referred to, in the province has got a total of 6 centers of excellence. 5 are located in the Department of Social Development. 1 is located in eGov. And it focuses mainly on, the name says, e-government. It focuses on issues around the 4th Industrial Revolution. There's training, there's whatever. If you go onto their website, you'll find what they do. But the model is the same as what we have. So in our case, and it's slightly different from theirs, in our case, the young people that we normally get, the better percentage of the young people that we have there come from families that we give assistance to as the social development. So we identify a young person from the family and train them along the stream that they are interested in. We don't force them to produce class if they're not interested in producing class. We find out what is it that you're interested in, and we skill you along that line. And the reason is to avoid dropouts. And all of our trainings, by the way, are accredited. And where possible, we will link you with opportunities. We're still working with national departments and other partners to make sure that young people that we exit from remember the intention is to exit them from total dependence on government handouts. Because we recognize the fact that, remember, we work with psychologists and social workers, we recognize the fact that people want their dignity to be restored. People want, especially young people, you're mobile, you do whatever, and you want opportunities to do for yourselves so that you can then grow and self-actualize. So basically that's what we do, Chair. But I agree with the chairperson. Be proactive, young people. Let's go use that data for the TikTok. Get into the, you can have a little bit of TikTok, but the better part of your data usage, you are young after all, you will do it. But the better usage of the data, especially free data that is provided by government at whatever sphere, use it for research. You'll be surprised at what programs that we have.
Yeah, thank you. Over to you.
Good afternoon, Honorable Chairperson, MEC, Honorable Members, Executive Management of the Department, our critical stakeholders. The presentation, as we would have seen, Honorable Chairperson, it's more comprehensive. It's intended to ensure that all our critical stakeholders, they have got pertinent information that they might want to go through during their leisure time. I will only go to pertinent slides, not each and every slide. The presentation outline, basically, one is to outline the purpose and then talk to the strategic posture of the department, then part two, deliverology, and then highlight the annual performance plan interventions and also reflect on the targeted key priorities. Financial performance, already CFO has touched on that. We can now move into slide 3. The purpose is to present the 2022-23 APP in line with the national and provincial mandates to the portfolio committee and also to reflect on the strategic posture as well as the midterm performance, as we're only left with 2 years to conclude the term in terms of the strategic plan. We can move to the next slide. Contextual analysis, here we're just basically reflecting, Honorable Chairperson, MEC, and Honorable Members, that in finalizing the plan, we have ensured that we align ourselves with the NISAR guideline. The plans were also submitted to OOP, to GAS, AG, National Department, for their analysis and their inputs, and they have been considered. But we have also consulted with the NPOs. I'm sure NPOs are aware we had sessions, various sessions in consulting, in finalizing the APP. We can move the next slide. Let's move the next slide. Here we're just reflecting the program structure of the department, that we have got program 1 to 5, administration, social welfare services, children and families, restorative services, and development and research. We can move the next slide. In this slide, Honorable Chairperson and MEC, Honorable Members, we're just reflecting that the programs that are highlighted in red, this program, we have cascaded them to operational plan, just to ensure that the department only focus on the high-level GGT priorities, national priorities, as outlined by the National Development Plan. But they are managed in the operational plan. We can move the next slide. Here also we're reflecting the programs that we have in Program 2, as reflected there. We can move the next slide. In Program 3, we're just reflecting that the early childhood development and partial care, as we all know, Honorable Chair, that it has since moved from the beginning of this financial year to Department of Education, as indicated earlier on by DDG and MEC. We can move to the next slide. Here we're just reflecting programs that we have on Program 4. We can move to Program 5. Again, we're reflecting the kind of programs. It's for information, just to ensure that everybody has information, including our critical stakeholders, to say when we say Program 5, what does it entail? Okay, we can then move to slide number 13. Here is just to indicate a confirmation to say the strategic posture, which is basically the vision, the mission, and the impact statement, has not changed since the beginning of this 5-year term. We still maintain them. The caring and self-reliant society in terms of the vision is the same with the National Department of Social Development and all the province of social development. The mission, the impact statement, outcomes remains the same from what we have had since the beginning of the term. We can move to the next slide. Here we're emphasizing, and it's in line with the comments, the questions that were raised by our important stakeholders, the issue of respect, the issue of dignity, integrity. So we value all this. So anybody, any official who renders service and does not value this, it is important that stakeholders must communicate like DDG and HODs as indicated, and then the department will be able to process that accordingly. But these are the values that we uphold as a department. Let's move the next slide. Here we're just reflecting, Honorable Chairperson, to say our plans are still in line, informed by the National Development Plan, the SDG. So we have ensured that everything that is reflected there, we're able to account for, so they are fully aligned. We can move the next one. Here we're just giving the details in terms of what are the sustainable development goals and to say what are the priorities or what are the contributions in terms of the department, in terms of that third column. We can move the next slide. Here we're just reflecting in terms of the provincial and the national mandates, the 2019-2024, but most importantly, just to reflect that in terms of the MTSF or national priorities, our contribution as a department, it's more in terms of priority 2, which is economic transformation and job creation, as well as priority 4, which we are leading as a department, consolidating the social wage through reliable and quality basic services. And again, when you go to the provincial priorities, we are contributing to priority 1, economy, jobs, and infrastructure, as well as leading priority 4, safety, social cohesion, and food security. We can then move the next slide. Here again, we're demonstrating the alignment with the GGT priorities, as well as the national priorities, by giving the specific indicators and the work that we're doing on the last column. We can then move the next slide. Again, we'll continue to demonstrate on slide 19 in terms of the alignment. I will not go into details. I'm now on slide 20. Priority 1, we achieved 40% in terms of the midterm performance. We only left with 2 years to conclude the 5-year period. And then in terms of priority 4, we have achieved 52%. So we're almost halfway achieving these priorities. We can move the next one, which is slide 21. Here we're reflecting in terms of the national priorities, 29% and 50% in terms of priority 2 and priority 4. We can then move to slide 23. Here we're just reflecting the CREEP principles. I think I've already reflected in terms of how we have ensured that we elevate the APP, that some of the indicators have been cascaded to the operational plan, and that there's an ECD function shift, as I've already reflected that since the beginning of the financial year, and that the FSC is on the GG provincial indicators. We can then move 24, we're just giving the details, Honorable Chairperson, Honorable Members and MEC, just to say how many indicators we have in terms of GGT, which is 38 indicators in the APP. Standardized is those indicators that we receive. All departments are expected to implement from National Department of Social Development, so we have also included them, is 57. Non-standardized, Honorable Chairperson and Honorable Members, is basically indicators that the department will then decide based on the engagement with the portfolio committee and other stakeholders to say these indicators are important. 2022-23, so in terms of this APP, like I've said, we have been able to reduce them. So we are, the total number, it has moved from 160 in the previous financial year to 88 indicators. I will then move to slide 27. We're just here giving the details to say out of those indicators, only 5 indicators we had to reduce the targets, and there's an explanation in the next slide, which is slide 28, to say these indicators, because of the context, I'll just give one example. Number of older persons accessing community-based care and support facilities, which is the service centers and the Leisure Club, we had to reduce the target because the context is that capacity of complying service centers number were reduced as they review their health permits and were reissued with a lesser number. So for an example, if the Department of Health decide to reduce in line with the legislative framework, we are also required to reduce. So all the indicators that I've reflected here, they were presented through the different committees of the department up to the MEC, and then endorsed that there is indeed a context backed by legislative framework to reduce. I'm now on slide 30, Honorable Chairperson, just to reflect that there is a significant improvement in terms of the performance of the department. Last year, this time, Honorable Chairperson, Honorable Members, our performance was at 59%, and now we're talking 73%. So it does show that there is significant improvement in terms of the performance. I will then move into the deliverology priorities, which is the high-level plan, which is the plan that gets signed between the Premier and the MEC. I'm now on slide 34. I'll not go indicator by indicator, just to indicate for the purposes of our stakeholders, Honorable Chairperson, to say the column that says midterm actual, it reflects how we have performed so far. In terms of the 2.5 or 3 years, we are remaining with 2 years. So the first indicators, just to give an example so that I don't go each and every indicator, number of beneficiaries participating in the welfare to work. So the target that we have had for the 5-year period is 76,908. And the midterm actual is 36,542. And we're saying as at midterm, which is last year, September, we're at 48%. So you can see with the 2 years that is remaining, we will be able to realize if everything goes according to the plan, the way we've been rolling. And in terms of the next indicator, 37%, and the last indicator in this slide, 61%. So there is significant progress in terms of the implementation. On economic empowerment, we can see there already we're closer to reaching the target for 5-year, Honorable Chairperson, at 98% in terms of the cooperatives linked to economic opportunities. So we're doing steadily well there. I'm not going to go into the desired outcomes. Slide 38, again, we're reflecting the performance there. I'll not go indicator by indicator, but you can see there's only one red there. That shows that we're doing a sterling job. I'll then move into slide 40. Again, there we're reflecting progress in terms of the midterm actual and also giving those social infrastructure that have been completed and are in progress in the different communities. I'll then go into the next slide. Services provided to learners in the high school. We can see we have already surpassed the target, Honorable Chairperson. Number of school uniform, I think already in the responses that were given by the department, the challenges and how we're dealing with challenges were demonstrated in terms of the school uniform. So we're at 50% there, 15%. Dignity pack, again, here there's a challenge at 26%. But the department has a plan to deal with such issues. On slide 45, also there's 2 greens and 2 red, just to indicate the progress. On slide 46, we're doing well there with 100% and 90%, and only 47% Kimoja, which is a fair progress. We'll be able to reach that target in the remaining 2 years. Just to say, attain outcomes, when I'm in this slide, because I've not talked to outcomes, Honorable Chairperson, is just to say, when you develop each and every program from program 1 to program 5, what do you seek to achieve? Which is to change, to ensure that there's positive change in the lives of the beneficiaries that we're saving. But in your spare time, you will be able to go to that and be able to see what do we seek to achieve in terms of each and every outcome. Okay, I will then move to slide 48. Again, there we're doing sterling job, 51% and 119%. In terms of the crime program. And then in terms of HIV and AIDS, we can see 73%. And the other 3 indicators, it's fair progress. We should be able to ensure that we improve performance there in the remaining 2 years. Social infrastructure, these are the projects that we have in the different communities, social infrastructure, in ensuring that communities are able to access services. I will then move to slide 43. Again, it's a progress in terms of the social infrastructure. Slide 54, services in terms of the older person, 47% and 52%. Also, it shows that there is good work there, noting that there were specific strict regulations in terms of the service for older person, but we have been able to achieve at 40%, 47% and 52%, and we still have 2 years to realize the remaining targets. Disabilities on slide 56, 49% and 52% respectively. I will then move into slide 58, children placed in foster care. That discussion that we had here, Honorable Chairperson, in terms of foster care, we are at 26%. And then I'm going to go into GGT. This is just to reflect that we still ensure that we implement the TMR of the province. And on slide 64, we're just reflecting there that in terms of the effective financial management, 85% of the audit recommendation implemented, so we are implementing the recommendations, and that we're trying to reduce the vacancy rate. I'll then move into slide 68. Again, the emphasis on these key programs, as the CFO has also outlined the budget for this financial year and the subsequent financial year. Important work on slide 69, we're also still rolling our social crime programs, crime prevention against women and children. So we're just reflecting the emphasis, that all the emphasis that have been put in terms of the GGT, we have reflected them in our APP. On slide 73, I'm reflecting in terms of the SEP 1 million for the province, and we're reflecting here, as all departments are expected to contribute, but this is the contribution of the department. We can see we're doing sterling job there at 82%, 48%, as well as 74% in terms of income generating programs. Youth development, also here we're doing great job. We can see in terms of skills development, the question that was raised in terms of the skills development that we're offering, we're at 61%. And in terms of the percentage of funded youth development structures that we're funding across the province, we're at 96%, which is quite impressive. I'm now on women empowerment. Again, here on women empowerment, Honorable Chairperson, we're at 47%, 49% in terms of the number of women on child support grant linked to economic opportunities, which is an important indicator for the province. Here we're just reflecting, we are required, like there was a question that was raised by one of the stakeholders in terms of the work that we do in the different wards, different regions, is just to give the details as required by the DD model. On slide, we're reflecting to see where are these services. You can see we reflect the district, the location, we even give the coordinates so that we are able to access those particular services or to give the details to the beneficiaries and the communities. Financial performance was already presented by the CFO. So with that, Chairperson, I recommend that the Portfolio Committee note the approved Gauteng Department of Social Development 2022-23 APP, which is guiding delivery of commitments in this financial year. Thanks, Honorable Chairperson.
Thank you very much for the presentation. Honorable members and our fellow partners, our important stakeholders, I'm going to take clarity-seeking questions. We were supposed to break by 1:45 for lunch, but then I see it's a little bit over that. It's almost 1:50. So I'm just going to take few clarity-seeking questions and allow the department to respond. Then we can break for lunch. We're supposed to come back at 2:30 so that we can take a presentation from SASSA, a presentation on the SRD, Social Relief of Distress Grant. So we will take that presentation after lunch, engage on the presentation, and then that would be the end of our session. But I will take hands now. But CFO, I just want the department just to clarify, because with the migration of the ECD to education, I thought the infrastructure part has also migrated there. But I was surprised there was an amount of 9 million, for instance, for example, which was budgeted for, say, Batubonke ECD. And I've seen some of the infrastructure projects that are in your APPs. So I just want clarity to say, why didn't then the budget migrate as well with the other parts of the budget to Department of Education? If you could just clarify that part. Let me take hands from honorable members first, and then I'll take hands from your side. Member Engelbrecht.
Chair, thank you very much. I'm very concerned at this presentation that says that indicators will no longer find expression in the APP and will be monitored through the operational plan. And I'm really very concerned, because this means that we as a portfolio will not be able to evaluate, to monitor what the department is doing. And I'll give the people that are sitting here and just an example of the type of indicators that we will no longer be able to see. And I'm really concerned. For example, part of the indicators that will be moved out will be the number of MPOs that will be funded. Those are the type of indicators we will not be able to see. Now, it's very important that we as a portfolio know the number of MPOs, the MPOs that are being funded, the outputs, you know, what requirements are they meeting or not meeting. So now suddenly these very, very important outputs are being removed from the APP and we do not have access to the operational plan. So suddenly this is silent. And the moment something is hidden and we cannot evaluate that, I get very, very concerned. Another thing that will be hidden from us is the older persons. That output is totally removed. So I'm concerned because we are not being told which are the indicators that are being removed. We're just being told that other indicators will no longer find expression in the APP and they will go to the operational plan. So I would like clarity why this is being done, exactly which indicators are being removed, and I would then actually request that these indicators go back to the APP so that we, as the portfolio, can do the monitoring and evaluation that we are supposed to do over the department. That is my first question, Chair. Then the second question that I have is in terms of the outputs that are given in terms of crime. I'm just trying to find that page because if we look at the outputs, it sounds very impressive. Just trying to find it. I was going to look at it somewhere. I was going to mark it. I do apologize. If we look at the outputs, it looks very impressive and it talks about victim empowerment, about women and gender-based, but it says nothing about crime prevention on children. So the APP is exceptionally silent about intervention for children and the diversion programs for children. So I'm concerned about that. There's a total lack of that. And it doesn't look and it doesn't appear as if the crime prevention strategies are effective of the department. Maybe I'm missing that. And also there are no outcome indicators in terms of the crime prevention strategies for children. And then the last question I'd like, Chair, is if we look at the outcomes for school uniforms and dignity packs, looks very impressive on paper. However, for the past, I think, 2 or 3 years, every single year there are rollovers regarding school uniforms and dignity packs. And every year the department promises us that they will be catching up on the outcomes which they are outstanding on. And not on one single year has the department caught up on the outstanding outcomes of previous years. So we're looking at the current outcomes, and then the outcomes look great, but what about the outstanding outcomes of the previous years? So if we can just get clarity on that. Thank you, Chair.
Thank you, Honourable Member. Any other inputs or questions from the honourable members? In the absence of that, let me open to the floor. Are there any clarity-seeking questions that you want to raise based on the presentation that was made? Yes, you can ask. Can I just get a sense of how many other hands so that we don't get motivated to just speak? Let me get hands for those that really have pertinent questions that they want to ask before we break. Only one. Okay. You can proceed, sir. Let them give you a mic so that you are captured on the audio.
Thanks. It's an honor. My name is Samuel Mashimzi. I'm from Tembisa. Actually, I am a beneficiary from the Department of Social from the earliest phase in terms of my age until today. But I've noticed that there is this major weakness when coming to the development of our community. in particular in Gauteng. All things are in paper, but we don't see any tangible things. You have mentioned the infrastructure in terms of child and youth care centers, Walter Sisulu. I think when they started, it was around about 1999, you see? So until to date. So we don't even show us the pictorial evidence to say this is on a planning phase, it's where and where, because we're in Gauteng. And then all of us, we know that Gauteng, it's an absorber of all people based on the opportunity. So the lack of development in Gauteng, it has a negative impact to other provinces. The second part of it, it's more on the accountability and the governance. You know, if we don't have accountability and transparency, we won't be able to attain what we've indicated. And the social development is the core, because you've mentioned various departments, or crime, meaning SAPS, or let me say community safety, and also the education. You have named it. The experience that I've seen in Tembisa is that we've got the provincial government, we've got the regional government, we've got the local municipality. But at the local level, the social department, they've been disarmed. They don't have resources, and that's where they are. My suggestion, protocol observed. Kindly, one, organize a site inspection or site visit or study, whatever the name, in Tembisa, to determine in terms of the lack of social development across all sectors, whether you're NGOs that you have funded. And then also the status of those NGOs, will be the buildings. I don't claim, I don't want to be populist. You see, I grew up under the Department of Social. But we don't develop when coming to social. I've seen in one of your presentations, you have mentioned the homeless part of it. But you don't mention the issue of drugs, the Nyaupe thing. And then I'm putting a challenge, as protocol observed, to say, are you aware about the degree of the disadvantage that we are facing at the locality? I'm talking about the section, the informal settlement. You see? Are you aware? You are not. So basically, we're not living there at the provincial level. We're living at this grassroots level. So maybe next time, Chair, we need to get a tangible report. The other angle is that in most cases, or in most circumstances during this type of sessions, the portfolio committees, they dominate the discussions. It's one question, you know? So can you kindly review that type of a public participation and engage, so that next time you'll be able to say from Tembisa NGO, have given you 1,000 rand. Stand in front of us and tell us how best did you. Because we cannot keep on funding NGOs and funding NGOs and funding NGOs. And then therefore there are no tangible inputs. So I put the challenge to say we, as Tembisa and on behalf of them, we are able to host you and go to each and every NGO and each and every center. And we are able to show you that there's no money for, or should I say the value for money. There's no value for money. So these are taxpayers, and we know our country. No one will tell us that he or she doesn't know that our country is standing on the one foot. So we're wasting money funding NPOs. I'll speak and I can speak until, you see, but it's an honor, you see, and then it's not more on me thinking as if I'm much better compared to other people. For me to belong to the community service or to the community development or as a community activist, it has saved me not to off-ramp to other negative things. But the young people that are coming behind me, they're a lost generation. I had a chat when I received this type of an invite to organize a young person that is a victim of Nyaupe to come and make a presentation, to say, what are you doing as elders when coming to the young people? What are we doing about the future? If we can't eradicate drugs, but we're talking about millions, you have resources, but you can't even show us anything to say, this is our output, literally. So it's an appeal, you see, to say I'm challenging you, to say after this session, we make arrangement to go to Tembisa. I'll communicate with people that are belonging to skills development center in which you don't have an access. We have resources in Tembisa. You know? Lastly, Chair, I request, you see, I used to work at the community development centers. That concept, it was very brilliant. They were around about 26 in Gauteng. But they are all dead, not literally, collapsed, you see? So therefore I requested this document. It's called Operations Manual. It was developed by Mr. Itumeleng Tebogo. Thanks.
Okay. Thank you very much for your input, sir. Let me assure you, for Rona as the Portfolio Committee on Social Development, we will be visiting Tembisa very soon. It's already there in our TEM program, and SIPO has confirmed that. And I'm sure outside of this meeting, he can share with you the dates and the venues. We will be visiting about 2 centers there, where we will get into the nitty-gritty of what you're talking to. And when it comes to the drug substance abuse, I remember we went to Kalinen where we had a public meeting, you know. Yeah, in December 2020, just before COVID struck. We went there and we had people who had evidence, the former drug users that had been rehabilitated through the department, SANCA, who came and testified in front of the masses of the people who were there to tell them how the department assisted her and how she wants to really develop and change her life because of the help and the assistance that she got. So there is some work that is being done. It might not have reached you at your area, but we will be coming to Tembisa, let me rest assure you. But I'll give this opportunity to the department to just respond to some of the issues that you raised. I don't know who's going to have the first bite. Yes. And all the questions that have been raised, including the members.
Thank you, Honorable Chair. The CFO will respond to the ECD, and then the Chief Director Strategic Planning will respond to the issues of indicators, and then HOD will then give us a complete picture, and then MEC will close on our behalf. I'm delegating upward.
Thank you.
The roles have changed, MEC.
Thank you very much, Chairperson. Chairperson, I think that there was a few basic and logical decisions around why we kept the infrastructure budget. I think firstly, the capacity within education and the infrastructure unit to immediately have taken over the functions on 1st April was one of them. And then secondly, the majority of these projects is in essence in the last final stage, and we basically have 1 more year of budget allocation to that. So we found it more fit for us to just conclude on the project than handing it over, creating more delays while you're still trying to build capacity so that the same team runs with that, because we couldn't relinquish any staff in the area of the infrastructure unit to cross over to education because of all of the other infrastructure needs that we also have. We've also split it between, because obviously we have got integrated facilities where there is an ECD within the facility as well as other facilities, and then the ones with where it's just the ECD. So in essence, the ones with just ECDs, where it's completed, has moved completely over to education. And then from an infrastructure, from a maintenance point of view, we are still taking care of the maintenance of the integrated facility so that it's under one thing, so that there's not, from an administrative point, it just made a little bit more sense for us to run it in that way. And then as we conclude on the finalization of these, we will hand them over to education to then take over it from there once they're finalized. Thanks, Chair.
Thanks, Honorable Chairperson. Just to respond to the question raised by the Honorable Member in relation to reducing indicators and the rationale behind that. It is an important question, Honorable Chairperson. I must say, in the department, we also had extensive engagement with program managers asking, why are you cascading these indicators to operational plan? Because they thought maybe it's not important. And that's not the case. The call has always been made. If you go to the framework on planning, which is issued by DPME, strategic plan is a high-level plan of the department. Below that, you will have an operational plan, which is also expected to be developed and reported on. It's so ideally, you should have less indicators because the high-level plan, your national priorities, which is a standardized indicators given by national, as well as the GGT indicators. Now, just to demonstrate the point, Honorable Chairperson, if you look currently, 21-22 financial year, the APP of the province, Department of Education, which is much bigger than this department, has got 43 indicators. And oversight has also been raising, oversight bodies were AG, DPME, to say you can't have so many bulk indicators in the APP. So education had 43 indicators. Department of Health, 54 indicators. We had 160 indicators, and were called upon continuously. Try and rationalize, reduce. But reducing does not mean the work is not important. You cascade it to the operational plan. You go to our own space, social development. Western Cape had 48 indicators. You go to KZN, 77 indicators. But what they do, because it's a requirement, it's a mandate, that GGT indicators, as agreed by the Premier and the MEC, will always feature in the APP, standardized as dictated by national. So over and above that, what the department has been doing, program managers will say this indicator is important, this is important. It is important, but it can always be reported in the operational plan. So that is the rationale, because if you look currently at 88, we still, in terms of national department and provinces, we are leading department. But we have ensured standardized GGT and other indicators in the department are still part of the APP. So that is the part of the rationale. So that we align ourselves as to what is the strategic plan. You cascade them to operational plan, it's still important, you still report. Thanks, Honorable Chairperson.
But will the portfolio committee get access of the operational plans? Is that?
Yeah.
For example, if you say NPO.
Thanks, Honorable Chairperson. The information will still be given because, and the Honorable Chairperson, a member pointed it quite correctly, to say if you look, Honorable Member gave an example of funded NPOs, all the indicators, and it's correct, have been removed. Because in terms of the planning framework, even AG was saying that to the department over the years, that is an input. Input is what you give. Because when you say funded, so when CFO reflect on the budget, that information is there to say how much has been given to the NPI. But you will then not put as an indicator. You will just put a schedule when the committee says how many were you funded when you talk about allocation. And then in terms of all the other indicators, the emphasis has been the evidence is still there in the regions. So when it's required by the portfolio committee, through the operational plan, because it's a requirement of planning, to say you still report on operational plan, but it's not a high-level plan. Because once you put everything there, then it loses the meaning of what a strategic plan is all about in APP. Thanks, Honorable Chairperson.
Okay, HOD.
Thank you very much. I want to respond to other questions. I'll start with questions around crime prevention and support. The Department of Social Development, in terms of the crime prevention strategy, we are focusing more on children, but we are also taking into consideration the adults that are in conflict with the law. So if you look at the services that we are rendering, you ask specifically around intervention for children. I just want to say to you, we do have diversion programs. As Chief Director Sibisi was indicating, we don't write all the aspects of a sub-program in terms of the interventions that we are doing, but they are there, including the type of programs that we have in our child and youth care centers, including those that are being done by the non-profit organizations that we are working with. So that information on the diversion program is there. Around issues of school uniform and dignity packs, Honorable Member, yes, you are right. The department had serious challenges around that. What we have tried to do as a department was to say, for the years that are left for this current administration, we will be upscaling. We we have managed to deal with that challenge. And I think when they presented, they indicated that we are now going to do panels for school uniform. And they also highlighted the fact that the tender for the dignity pegs, if the court judgment didn't come into place, I think we would have concluded on it, because already by the 25th of February, we had advertised. But then we were caught up in that entanglement with the court judgment. So what we tried to do is to say, for the last years, these are the numbers that will fit in to ensure that we upscale in that regard. And then I will come to Buti Samuel Mashimze. I think it's very critical that I highlight the fact that you mentioned the fact that we were supposed to show perhaps pictorial or pictures. You gave an example of Walter Sisulu. I want to tell you that the department is managing 12, if I exclude Father Smangaliso Mkasho, institutions. And the bulk of them are child and youth care centers. But we cannot advertise the child and youth care centers because in terms of child protection and care, we need to protect those children. However, communities would know if we have a child that is being abused, neglected, abandoned, our social workers will be able to facilitate that that child be placed in our care as a department. And it's done through the court. And this is not to hide away information from you, but there are certain things that we need to take into consideration when we talk about those centers. So I just wanted to highlight that to say they are there in existence, and they've been there for a number of years. They are not newly built. They've been in existence for a number of years. Around issues of development of the community, I think maybe in this type of forum, we are not able to unpack in details. Our program 5, it's aimed at community development. The funding of NPOs, for example, is also part of community development. And as a department, we are funding in excess 2,000 NPOs in Gauteng. Because the argument there is that if we were not funding them, they would not be able to develop communities where they are working. So maybe we are unable to do that. And you are correct. One of the challenges that we are faced with as a province, not only this department, and I think you will know that the Department of Education, year in, year out, at the beginning of the year, they've got excess number of children that they have to accommodate because Gauteng is considered to be an economic hub. And much as we strive to ensure that we accommodate everybody, but I think you will agree with me that if perhaps people could come earlier, we will be able to plan for them. You highlighted the fact that at local level, there are no resources. Let me say to you that one of the critical challenges that we have in Gauteng is around office space. Most of the townships, they don't have buildings that we can hire as a department so that we can be able to bring services right at the footsteps or right within the communities. We are trying in terms of ensuring that we also improve in that sense. But we are much aware, and we do try to say maybe we need to do the mobile type of services so that we can be able to reach everybody. Because you categorically spoke about issues around substance abuse and informal settlement. And I think the Honorable Chair did highlight the fact that we do have, maybe we haven't, but I remember very well, was it in 2019, there was one community outreach that we did in Tembisa. I was part of it. We were in a school there. And I want to also emphasize, because I remember there was someone earlier on who spoke about the school social work program. Department of Education gave us a list of schools that are within areas that they were saying the children there are most vulnerable, and substance abuse was one of the key challenges that they were highlighting. So if we are not in an area where you see us, perhaps we need to have a bilateral with you. It could have been an oversight, but we tried to go to areas where we were given by the Department of Education. And also we work with community safety and SAPS. They also tell us areas where there's high crime, and we try to reach out to those. The issues around informal settlements. Informal settlements, by their nature, sometimes it can be challenging because they mushroom very quickly. They overtake the services that are being brought to them, but we also strive. If I can give an example, I think sometime last week, I was driving on the N12 West. Suddenly I see that there's an informal settlement that is being established there, and which I didn't see. I think sometime early this year, we went somewhere along that route. I traveled along that route, and I was wondering when did they sprang up there. So what I'm highlighting is the fact that it's a concerted effort by all parties involved, including the Department of Human Settlement, so that we can also bring services to those. So I think I will pause there because I just wanted to highlight the fact that bringing services to people, it's a concerted effort by all parties. And we also encourage community members to bring those to us and say there's a new settlement here, and we feel there is really no one that has actually focused from your department as social development. Thank you.
Okay. No, thank you very much, Honorable Chair. I think the officials have responded eloquently to all of the questions. Suffice to say, Dr. Samuel, the invitation is accepted as well from the Portfolio Committee and ourselves. But just for you to remember that there are protocols within the legislature broadly, legislature and how we work with them as EXCO. Normally what we do, like the example that the chairperson gave you around Bronkhorstspruit, they go to an area and we respond to whatever issues that they have found. However, we do have a branch within the Department of Social Development, stakeholder relations. So one of the, yeah, Sbu, he's at the back there. I would like, Sbu, do you mind just standing up for, yeah, and then have a conversation later Samuel, so that we can arrange, and then we don't largely, the Portfolio Committee, to pay you a visit in Tembis. We'll come there and see what you have. On issues of accountability, what you were suggesting that NGOs should do, we had a bit of a discussion here with the DDG that it's something that is, it's interesting to us, but remember, like the HOD said, we work within the ambit of the law, so we must check if it is possible, and if so, how we can do it without breaking the law. So we'll have that conversation with you, but your enthusiasm is very contagious in a positive way. Thank you.
No, thank you. Thank you very much. We've come to the end of this session. I would request that we break for lunch and reconvene. I see we took most of the time. I thought we were going to break at 1:45, but now it's already 20 past. So let's break for lunch and come back at 3 o'clock. Is it still fine, Sipho? Let's come back at 1:45. Okay. Sipho says, my boss says we must come back at 1:45. So let's go down to the ground floor, have lunch, come back and receive the last presentation on the social relief of distress grant. Thank you very much. The meeting is adjourned for now. Honorable members and colleagues, stakeholders, visitors, pastor, can you please settle down, take your seats? Let's proceed with our meeting. I see it's raining outside, so I think the sooner we finish, the better, so that all of you can go home safely. Welcome back. I hope that you enjoyed your lunch. I know it took longer than we had anticipated, but I'm happy if everybody had an opportunity to nibble something. As we continue with our program, just to let you know that we have excused the MEC and the team because they have already done their part. They had finished their presentations. So we thought that we should release them so that we continue with this last session where perhaps we would also require your engagement with the Department of SASSA. So we will be receiving a presentation from a briefing by SASSA on the 350 Social Relief of Distress Grant. And the presentation will be done virtually by the Senior Manager Operations from SASSA, and his name is Mr. Godfrey Mahlonyane. Am I correct, Sipo? Mohlonyane, yes. Mr. Godfrey Mohlonyane, I hope you are ready on the virtual platform. The stakeholders are here and the members are ready for your presentation. If you are ready, please take us through, sir. Over to you. Thank you very much. Can you just indicate if he can hear us? And perhaps check if his microphone is unmuted on the other side, just so that we can proceed without any problems. Yeah, just check him, Sipo.
Good afternoon, honorable members. I'm here. I'm hearing you very loud and clear. My name is Mutsile Godfrey Mohlamunyane. I work for South African Social Security Agency on behalf of the Regional Executive Manager, I will be giving you a brief regarding the issues within SASSA, more especially on the 350 grants. I am waiting for Mr. Soli just to let me know if he's done with the presentation so that I can proceed. Thank you, Soli. Honorable members, I'm here, as I said, to give the portfolio committee information regarding the social relief of distress. As you can see, I put social relief of distress, insufficient means of income, and 350 in brackets. We are no more calling it 350 because of the legislation changes, and obviously the money will also keep on changing if the economy allows that. So the 350 funds, and how often do a grant recipient is supposed to review. I know most of interest to the members was on 350, but then we tried to touch other grants because it's very important for us to know the information relating to other grants, as we are not providing only social relief of distress, insufficient means of income. Can you go to the next slide, please? Okay, the draft, we had a legislation that had to change because obviously we are moving into the new era, technology is there and other things. So our regulation was not in line with what the future dictates. For instance, your application, you would need a client to be in front of the client, of the official, for you to take an application, whereas with the new one, those kind of things have been changed because we had to align ourselves to the current situation. So the draft of the regulation was published on the 25th of January 2021, and then from the inputs we requested from internal, we had the sessions in SASSA whereby the inputs were given to the draft of the regulation, and Department of Social Development obviously had a service provider that was spearheading the process so that it could be more effective. And around November, the state law advisory advisors were rectifying the legislation. Can you go to the next slide? So upon ratification of the legislation and promulgation of the law, obviously, as we are all aware that we moved out of the state of disaster, then hence some of the application had to be stopped at some point for the regulation to be promulgated, which was done on the 22nd of February. So therefore, the SRD was then extended for a period of 12 months, starting from the 31st of March, until the end of the 31st of March 2023. That was after considering the availability of the country to maintain the impact of the virus, and consideration is therefore made to prepare for was made to prepare for the life after disaster, as we're no more under the state of the disaster. So that had also an impact on regulation that has to deal with SRD, as we wanted to accommodate the pronouncement by the president that we need to continue with our SRD 350 going on forward until the 31st of March. So there were other form of disasters that were relief disaster that was also affected by the legislation, which I'm not gonna bore you much on that because now the focus is on this. So we are talking about food parcels, we are talking about school uniform. Those were also touched when we were continuing working on the legislation. Can we go on the next slide, please? So from when we started to re-implement the SRD, means insufficient means, clients were requested to or advised to apply again, simply because they are no more applying under the state of national disaster. They are applying on a continuation of a program that is seen to be new, because it's just to maintain the situation that we are in, and we are no more under disaster. So we also advise our clients to use the website as indicated in front of you. These are still the same ways of applying. We also advise them to use a WhatsApp to apply. And also, we also advise them to utilize the banking details, as we are all aware that we had an issue with our SAPO, South African Post Office, currently in payment of the grant recipients, which I'll also deal with as I continue. So we are advising our clients not to go through SAPO route, but then to ensure that they use all their banking, national payment systems such as banks. And those that are having the SAPO cards, we are also advising them to update their banking details online, so that we can have a proper or more effective means of paying them. And for those that having those cards, SASSA SAPO cards, we are advising them to go to Checkers, ShopRite, YouSave, Pick n Pay, Boxer, and have an ID copy and a cell phone that has an access to the number that they used when they're applying, so that they can be able to get their monies. Next. So I just also put this statistics so that we can have a clear indication or picture as to how we are doing as SASSA in terms of this SRD insufficient means. I highlighted Gauteng so that we can also have comparison of some kind. As Gauteng, I would like us to just focus on April and May, which is the outer two columns. In May, these are the applications that were received. We had a total of 1,548 applications, and that was in April. So in May, we had 350,905 applications. If you can understand very well, some of the people were still trying to kick in and trying to apply again, and some of our clients are aware that we're still aware that started to know that we are no more in a national state of disaster. So they reluctant, some of them are still thinking that SASSA will still pay, but then as SASSA, we are trying by all means to take information out there to say whoever that tried to, that was in the system previously, please go back and apply, because you're applying under a separate or different laws or regulations in this regard, as we are no more under the disaster. Next slide. So this is a total number of applications as per vis-a-vis the applications that were approved and approved and payment in this regard. So in March, we managed to approve 2,090,730, and we managed to pay 2,016,583, which made 96.45% of the payments that were made. It's not as bad as is out there to say our people are not paid. So some of the little percentages there is because of the errors that would happen, or some of them are people that already are deceased when we approve between the approval and the payment. So hence the number is not as accurate as 100%. You can see it's the same level across all the 9 provinces. Can we move to the next slide? So I am giving you the overview pay points in Gauteng. As Gauteng, we will try to be very proactive by ensuring that we are closing most of the pay points simply because of the service level agreement that states that only if there is no infrastructure within a 5 kilometers radius of an area, therefore, as SASSA, we are allowed to close the pay point because of the expenses on paying a head of those people that were paying at the pay points. Another indicator or force that made us to go through to have this small number is because most of our clientele in Gauteng are utilizing infrastructures like your banks, your Pick and Pay, because we are more of economic hub as we compare to other regions. Our people are more inclined to the banks, able to utilize the bank accounts. We also give them an alternative or a broader choice when we do the application as to whether do you want to go to the post office or do you want to go to the banks. And the other thing that the last one that makes this number so little is because as you recall very well, earlier on, SASSA card was declared as not that much safe. Hence, we are no more issuing those cards because they are prone to fraud, to cloning, and other issues. So, as we know that the court also requested SAPO to ensure that all the cards are changed, and now we are no more issuing such cards because they will endanger the finances of our clientele. So the 800 clients are the clients that were paying within the Gauteng province, whereby 95 is at Bronkhorstspruit on Verwag, 21 is at Kanana. So Kolumi we have 131, Vereeniging we've got 33, Heidelberg we've got 11, and Johannesburg, Lenasia in Port we've got 564. These are rural areas where infrastructure is not available, where people are bound to travel more than 5 kilometers to go and access their funds. Hence, we are having these pay points open so that we cannot prejudice or disadvantage our clients. So next slide. So I just wanted to give you an indication of the numbers. As you know that from on the 11th of October, SAPO indicated that they don't have cash to pay all the clients. But as Gauteng, we were very fortunate because our pay cycle started on the 7th of May until the 9th. And by the moment when SAPO indicated that it doesn't have money on the 11th, already we were done. And from the 6th to the 9th, we are talking about only 855 beneficiaries who were not even affected, even if SAPO were to have those issues with us as Gauteng. The number is very insignificant as compared to other provinces. We were going to be able to attend to that, but then none of our clients were affected in terms of this. And this affected lots of branches in all the provinces, and it also affected the COVID-19 or SRD insufficient means beneficiaries that we know as 350, because post office by that time didn't have money. So not all of our clients were affected. And for those that couldn't get their money from the post offices, we implemented a contingency measures by ensuring that we redirecting our clients to national payment systems, whereby you get your infrastructures, as I've mentioned earlier on, the merchants such of your Pick and Pay, ShopRite, Checkers, and ATM for those people to get the monies there. For those that never had the ATM pins but are in possession of SASSA cards, we also issued the pin so that they can be able to access their monies from those infrastructures. Next slide, please. What is it that we are doing and we have done? We continuously reminded that our clients can be able to use the SASSA support card at any merchant, as I said. They can withdraw their monies as much as they want. They can use the cards to procure goods wherever they want to, as long as they are machines, and their balances will not be affected. If they balance left in the card, the money is safe and there will be nothing wrong in their monies. And we also inform them in terms of the challenges that SASSA, SAPO is having. We, in all the languages, we distributed, we had slots in the radios, the pamphlets, the WhatsApp recorded videos, and all other means that we applied in SASSA to ensure that the message is across the country and our clients are aware as to what is it that's supposed to be done in an event when SAPO was having the issues. Next slide, please. Payments of the grant stills. These are the issues that we come up when we pay clients. Just hold on for me, please. Just a minute. I was trying to check on my side because the slide that is presented here it has cut on the heading, so I can't really be seeing on top. So just bear with me.
It reads as follows. It says system-related issues, delays in payment of grants.
Yes. Thank you. My leadership, I've noticed that. So SAPO is responsible for disbursement of the funds. The moment SASSA has created a voucher or has sent a payment file to them. So because of the internal processes and the challenges that are seen by SAPO, payment are getting delayed. Hence, they were even questioned earlier on to say, but then why am I not getting my money? And when a person comes to SASSA, we say, but then we have paid you. It's because of the processes that we have done with the payment, and their responsibility is to disperse. And that's where the issue is. And because of their internal processes and the challenges that they are having, then that's when the delay in terms of payment are happening. But then from SASSA side, as I've shown you, we are always on par, 97%, 96%, 98%. That's how we are paying our clients. But then because of those issues, there are sometimes delays of money not being there, of money not being released, and all those kind of things. But then we are continuously advising our clients to ensure that they use their own personal banking details, which is the fast method of paying, because in this regard we are dealing directly with the banks. The money is disbursed from the Reserve Bank directly to them, and there are no hiccups as compared to the SAPO payment method. Next slide, please. This one is the issues, how often an individual is supposed to review or reapply. I interchangeably used this a term because we've got the term review the term reapplication are different. A review is when a person's grant is still active and there are SASSA integrity issues that we need to attend to. Whereas a reapplication is when a person is starting afresh from applying for a particular grant. So I know this question was also raised by one of the members previously to ask as to when do we really need to, when our clients are supposed to reapply for a client for a grant. Hence, we put the slide in so that we can share information with everyone. I'm going to start with the disability grant. A disability grant is done by our doctors in SASSA that we contracted, and they use a prescribed medical tool that is made drafted by SASSA, which determines the level of the impairment or the temporary disability of the permanent part of the disability of an individual. So hence the doctor at some point will recommend that a person will have to get a grant within 6, 7, 8, 9, or 12 months. So we've got a temporary and we've got a permanent grant. A permanent grant is when a person is unable to enter into labor market for a period of 12 months going forth, and a person that can be able to enter into a labor market within a period of 6 months, that person is not classified as disabled in terms of our description, meaning that if you've got a fracture and you know that in 4 months you'll be fine, then as SASSA you don't necessarily qualify. And if you've got a disease that is very controllable and that you can take a treatment for a period of 2 months and you are back to work, then obviously our doctors will recommend you to go through that, and that does not necessitate you to get a disability grant. So I thought that is very important because we often get problems with our clients. As long as I'm sick, as long as I have high blood, or I'm taking ARVs, or I'm taking a TB tablets, then I start to demand for a disability grant, which is not a definition in terms of our legislation. So any person who's unable to enter into a labor market for a period of 6 months, that person can be given a grant. And if it's more than 12 months, then it will be a permanent grant. And a permanent grant does not mean that permanent until you die. It means that permanent with review, meaning that the doctor can say, okay, you can get your grant, but then ensure that SASSA ensure that you lapse this grant in 3 months, or in 3 years, or in 5 years, or in 2 years, so that the person, we can review the impairment, or if the person has recuperated from the condition that he has been under. So hence we have those categories. Clients are requested to reapply because of the condition that has improved also, as I said. If it takes for 6 months and you are better, then, and you feel that after 6 months you are still not better, but the grant has lapsed, then you have a right to come and reapply. And we've got what you call a cooling period, meaning that after you have seen our doctor, you cannot come back and apply again within a period of 3 months. And you can only apply if you can prove to us that actually you have not recuperated and your condition has deteriorated. But then if you don't have medical proof to show us that, is either you go through internal reconsideration or appeal, or else you wait for a period of 3 months before you can apply again, because we also pay the doctors for the continuous assessment. So we cannot afford to keep on assessing a person this month, next month, August, September, October, November is going to cost a state a lot of money, whereas most of our clients are actually just trying to try their luck. But then if they do qualify, we do give them the grant. Can you go to the next slide? Review on old age grant and child support. This is basically purely focusing on the financial status. If you are an old age or you're a person that is receiving on behalf of the child, we know that we are paying because of you've got a threshold or of a person that is single or married, and we need to keep on checking on their financial status in order for us to continue paying them. So we ensure that we update the financial status, and as SASSA, we can also subject any client if there is a need. That need being a misrepresentation, maybe there has been a whistleblower to say Godfrey is actually working at Van Riebeck or is working at Mama Semula's kitchen. Then we start to call you and request you to provide us the proof, and we review you. Or if there is a fraud, or if there is, we need to update information for data integrity. Remember, we've got lots of movement. People are going to Mpumalanga from Gauteng, Northwest. As much as they cross the provinces, we need to get proper information. We don't want to see a person that is in Limpopo, registered in Limpopo, getting money in Gauteng, or registered in Gauteng and staying in Northwest. So if I'm in Northwest and I relocate to Mpumalanga, would like you to come and review your data, and the information should appear exactly the way you are staying in our system. So at some point, we just issue the notification letters to our clients and requesting them to come and review. And you will be surprised, members, because some of our people, you know that we know what's happening in Department of Home Affairs currently. You find out that people are coming from Swaziland, Mozambique, people are coming from Lesotho. They just come in South Africa only to receive the monies. So review is also assisting us in catching those that are always crossing the border and are coming back to get the money, or those that are just staying in Lesotho and the other neighboring countries and keep on receiving money from the bank. At some point, we need to say, come, we want to see you, we want to check your information, and we stop the money. Then we force them to come in. And when they come in, then that's when we request all the information and update. And if you are getting the money in a fraudulent manner, then we take it up, you pay back the money, and we investigate and you pay back the money if you are found to be at fault. And we've got SRD insufficient means. SRD insufficient means is reviewed, is reapplication every 3 months. This is simply to confirm that you are still in need of the grant, you are not employed as you indicated earlier on, or you are still living beyond the daily means. Then hence we are saying you need to come back in every 3 months. And for those lines that were declined as of the 22nd of April going forth, we are also giving them a latitude to go through our website to lodge an appeal, and so that that decision can be considered. Next slide. I think this was the last one. Thank you, members.
Okay, thank you very much, Dr. Godfrey, for the presentation, for the update. We always appreciate the updates given by SASSA, given the fact that now and again we do receive complaints from members of the public in terms of the grants that are not being paid, you know, and from time to time, when when we receive those complaints, we refer them to your office so that you can assist the beneficiaries to really access their money. But the funny thing is that most of the time you would find that SASSA would say, no, we have paid the money, but the individual would have not received the money for, say, 3 months or so. And I've noted that in your presentation, you talked about some system glitches. And I don't know why even up to now, you are not able to resolve those system glitches so that, you know, people can receive their payments without any problems. Because you can imagine if you were to wait for the 350 for 3 months, then it defeats the whole purpose of receiving the grant, you know. How do you then survive for the 1 or the 2 months or 3 months even? It creates a challenge to some of the beneficiaries. But anyway, thank you very much. I think I will take this opportunity to invite members of the Portfolio Committee as well as our stakeholders who are here to engage this presentation and ask for clarity-seeking questions so that, because they are also leaders in their own communities, they are able to disseminate this information. I think it's very important to share such information in these platforms so that they can be empowered with the knowledge. When they get out there, they are able to inform communities and direct them to the proper offices in case they've got issues with regards to payments of their grants. So I will invite hands from the table if there are any, and then we will then go to our stakeholders. Member Engelbrecht, and Member Badenhorst, Member Magagula, yeah, in that order. Thank you very much.
Chair, thank you very much. And thank you for the presentation. There was mention made about the disability and the reapplication for disability. I've been informed by residents that you have to reapply on a yearly basis. And my question is exactly that. If you've got a disability and you're blind, you're going to be blind for the rest of your year, for the rest of your life. If you can't walk or you limp or whatever your disability is, that's permanent. So I don't understand why you've got to reapply yearly, and that's apparently according to the SASSA officers. Now, the presentation talks about a 5-year application. I've never heard of a 5-year application. I've only heard of a yearly reapplication. So can I just get clarification why? I can understand if you are busy going blind that you might want to reapply on a yearly basis, but once you are blind, you can't go blinder. And once you don't have legs, you can't go more legless. You don't have legs, you don't have legs. So it doesn't make sense to me. All it does, it makes the queues longer at SASSA. It makes it more and more difficult for the applicants, and it makes them having to stay in the queue from 4 o'clock in the morning till 5 o'clock in the afternoon. So the rationale behind that yearly application makes absolutely no sense. Thank you, Chair.
Thank you, Member. Member Badenhorst.
Thank you, Chair. So I heard you speaking about a permanent grant and a temporary grant. Can you please clarify why a permanent grant and why a temporary grant? Because if you get 350, an amount that's very disgusting. 350 can't even sustain a little child. I don't know how do you intend it must sustain like an adult. But can you please tell us what's the difference between the temporary grant and the permanent grant? Thank you.
Okay, thank you, Member. Honorable Magagula.
Thank you, Chairperson. Thank you, Godfrey, for the presentation. I think it was loud and clear, but I just want to ask you or give me a clarity. I understand there were some government employees or people who were not supposed to get the SRDs and they did apply and got them. They now have to pay back. My question is, how were they been approved? While
you get the grant, that's when I lost you. I had you until you said why 7 were approved while an ordinary person couldn't get.
Yeah. Let me start before I get to say why. Is that why those people who were not supposed to get a grant or SRDs were approved, and how were they approved, especially government employees, and vis-a-vis those ordinary citizens who have been applying and were declined? And how were they declined while they do qualify because they're not working and they've never, some of them, they've never worked before, but they were declined. How were these been approved? Because even there are elderly who supposed to get their social grant monthly, but they were declined because they were saying that, no, it's either your partner is still working, so you can't get a grant. But those who are in the system of government were approved for the SRDs, and they are now have to pay back. How were they approved against those who supposed to qualify were not approved? Thank you.
Thank you, Honorable Magagula. Sorry? You want another bite? Okay, you can go, remember.
Thank you, Chair. Godfrey, my last question. Why must people wait for 6 months before they can get approved? Because there's a lot of people that's on a waiting list. And it's more than 6 months that they are waiting without any cent from the government. Thank you.
Okay, thank you, Honorable Member. Let me then open to the floor. Let me get an indication of how many would like to engage the presentation. I've got 3 hands that I've noted. Pastor Les, yourself, the gentleman at the back, Mama over there, 4 hands. 1, 2, 3, 4, 5. Okay, in that order.
My leader, is it possible that I attend to the 4 questions before we take another round? While
Okay.
I'm still fresh with the questions. Thank you.
Okay, no, it's fine. Okay, Godfrey, you can respond to the 5 questions.
So, yeah, I'm scribing by myself, so it's not easy. So I'm going to start with a question by Honorable Engelbrecht, where she asked that why people are supposed to apply on yearly basis. That is not correct. It's misinformation, where if they are telling you that or they are spreading information that people need to apply on yearly basis. We've got lots of grant recipients that are permanently disabled and they're getting permanent grant. Hence, I even indicated earlier on that if the moment your grant crosses 12 months, we regard it as permanent. But then we've got permanent with review and permanent without review. For instance, if I don't have hands or legs, or I am 100% physically disabled, I cannot do anything by myself, there is no way you will recoup, and the doctor knows that. That person, there is no way the doctor will say permanent with review. So there are those that would like to see them after 4 years, 3 years, and those are the ones that you are saying you are permanent, but then you come after 5 years, or I mean on the 5th year or after 4 years. So our grant starts from 6 months. It can be 7, it can be 8, it can be 9. They are given that those particular months simply because when they are getting examined by the doctors, that by the medical doctors, there are conditions at that particular time has a potential of them recuperating from where they from how they are now. But then at some point they become, we are not God and they are not God. Sometimes opposite happens, whereby a person health deteriorate, and that person, when he comes back, obviously you need to prove that it deteriorated, and you can move from temporary and move to permanent. And there are those that move from permanent and until to temporary or not disabled as yet. So not all of them. We've got lots of them, and it's very expensive also to us as SASSA to keep on assessing a person on every after 9 months. We do have administratively, we have a tracking document that indicates as to how what is the trend of each and every doctor. because you find out that there are doctors that you see that 100% of his people are coming after every 6 months. Those doctors are questions, and they are getting trained, and we further check as to why are they having 6 months on every 6 months, on every client, because you wouldn't know what are the reasons behind that. So we are very careful when it comes to that. So it's just that those that are not reporting to you are those that are permanent. Obviously, they wouldn't have a reason to come back and report. So mostly those that are reporting are those that are seen to be temporarily disabled. And the question by, the other thing, they don't have to wait for come many times or wait for long queues. We also have the online bookings that they can just quickly go online and book online for the doctor and come back to see the doctor and not keep on going to the office. The question by member Badenhorst, the difference, I think I touched the difference between temporary. She wanted to know the difference between temporary and permanent. Let me reiterate. Temporary is when a person has a potential of recuperating. Then we give you that leave period, or we give the benefit of the doubt that you might be better in 6 months, in 8 months, in 9 months, is because of the sickness or the condition. You are conditioned by the time of assessment, hence is temporary. And that grant will lapse and you'll have to come and start again. And if you are found not to be disabled after 6 months, you will not get it. And if you are found to have deteriorated or still on the same condition, the doctor will still say, okay, fine, even if I see you that you are still not okay, and I can still give you 12 months and see as to how the medication or the treatment will take you further after 12 months, come back. So those are curable conditions or diseases, hence they keep on checking, unlike giving a person a permanent grant for 5 years, whereas that person in 18 months would come back being fine. So that is more technical from our side. To the doctor's side, they are the ones that are able to see that, even though we are saying we are monitoring such. And I will attend to Honorable Engelbrecht's question, also the second one, why 6 months before is getting approved. It's not necessarily 6 months. There is a period of delays, as I indicated, that we would quickly approve and ensure that the payment is done. Remember, once the grant is approved, then you will be informed that go and collect your money or go on this day. That's where the problem is. And in terms of our approval period, we tried by all means to ensure that we have enough capacity in terms of that, and we have improved a lot. The only problem that we're having is when it comes to SAPO. And we are encouraging our clients, and please assist us in doing that. Let them give us the banking details is the better way of doing things, because this marriage of us and SAPO is making us fight with our clients. And we are very sorry about that, but then we've got other means that we can sort them out with. The last one, Member Makakula, SRDY, is it received by? It was received by the public servants, while an ordinary a person in the community is not able to get the grant. And why others that were still not employed, but then were still declined. We had a way of checking as to whether are you getting other means of support, and because we didn't want double dipping, and what we were relying on information, and some of the information we were misled by other institutions. I will give you an example. Why am I saying we were misled? For instance, if you go to unemployment insurance fund, they will give us a list, and as code free, my name is appearing there. because I've received my unemployment insurance fund that was 2 years ago or 3 years ago. But the data that we receive from Department of Labor would have your name on the list, not indicating as to whether is Godfrey still receiving UIF or Godfrey is not receiving UIF. That is the misleading that I'm talking about. So there was no accuracy in terms of the information that we were receiving. And some of the institutions were very quick in responding. Some of the institutions were very unreliable and were very slowly in responding. And some of the systems were not yet interfaced with such systems. Hence now, if you are on PESAL or you are on Person or you are on any government utilized system, we are able to detect because there is interfacing now. There is no government official that will go through that. That's why we managed to detect them. To identify them, to say this one are also on PESAL. So that's how we are improving in dealing with that. We are still lacking when it comes to the municipalities, and we are in engagement with the municipalities and to ensure that we deal away with those individuals that are stealing from the government. We have a list, and we created a relationship, and we will be exchanging information in that regard so that we can be able to block them. Thank you.
Okay, thank you, Godfrey. Yeah, let's proceed with the engagements from the floor. As I had pointed to, number 1.
Thank you, Madam Chair. Godfrey, in the West Rand, somebody received a disability grant. They are not able to work or do anything, and the doctor done a proper checkup, and so they got their disability grant. However, the person came back again after a while, and the doctor just looked at this person and said, no, you don't need the grant, no checkup, nothing like that, and the grant was taken away. How can you do that and not do a proper medical checkup on a person who's got a disability?
Thanks, Chair. Mr. Godfrey, thanks for the nice presentation. You know, Mr. Godfrey, there's a word, young people who are suffering. When they apply, they are saying there's a weight that they bakopanalelona each and every month. It says pending. Most of our young people who applied for 350, they are still pending. And it's been more than 3 months, others is 2 months. And secondly, it's around the issue of why should those people reapply every 3 months? The same people that we are saying they must go and buy bread with that 350, we want them to go back again to the internet cafe and pay money. Where are those people are going to get that money? Because 350 is nothing. Now, can you look around the issue at 3 months? Because to be honestly, you are making long queues. It's about to reapply and everything. Can you consider to say, monitor your system as department? Because department is full of staff. Monitor your system, check, because if you can see that person only any more money again each and every month than saying people they must go to the queues again or go to the internet again and pay extra money. Because that 350 is nothing. I'm just saying, can we at least reshape that thing, because there's a weight that it says pending. I've met a lot of young people. All of them, when we check, it says pending, pending, pending. And it's been more than 2 to 3 months now. Thank you.
Dumelang bagolo. Ke file Petuele go tswa L17 skills. Dumelang bagolo, ke file Petuele from L17 Skills Development Hub. Potso ya ka di 2. Re bereka ka bana ba intellectual and physically disabled. So bana ba a ke itse gore ga ba tshwanetse gore ba gole di grant. Tshwanetse ba ye ko SASSA ba le fail or ba ye ba tlhakatlhakane or ba ye ya. Just because fela bana ba ilo apply la di grant ba tlhapile. Bana gate ga ba qualify for ntwena and for the grant. Bana ba tswa go di special school go bontsha gore bana ba disable. Mara ga ba gole ba decline. Question number 1. Question number 2. Why ko SASSA ga motho for the 350 ga motho a tshwanetse gore a gole ebe ba mo decline ba re una le UIF mara a palla go kra UIF, not forgetting gore UIF we gola ga o fetsa 3 months or 6 months ke gone we gola, and then from there ha o sa tlhela o go gore ha o ka fetsa 6 months o sa tlhela o bereka ha o tlo gola tshwanetse o lo batla mosebetsi o batla ko kae. At least the government ba lekile gore ba re go ntshiwe di relief tsa 350 but ano ba re busetsa ko di ko one mathata a le a tšhelete. Ne ke kopa clarity mo tabeng e. Thank you bagolo.
Samanan, thank you for this opportunity from Gauteng Legislature. I remain Pabalo Makubelu from Ward 7 in Ruma Peto Zone, which is in Ikuruleni. Thank you, leadership. I was wondering if you can maybe make some things much possible for us as young people who are disgruntled and who do not have maybe much access to internet, your Wi-Fi and so forth, when you don't even have those free Wi-Fis that you'll be getting all over. Primarily, I'll be speaking in behalf of my brothers and sisters who I left back then in the location. Some of them don't even have cell phones, don't even know how to even access one because of their current situation of drug abuse and maybe alcohol. But I found myself one day assisting young people in my street and eventually escalated to a section and escalated to the branch itself in helping young people apply for this 350. I found myself also speaking to some of the people that are trying to be clowns and not really assist young people in particular when it comes to their issues. But because they don't have cell phones, they will be asking any Tom, Dick and Jerry to access their 350 without even any knowledge that when is it going to come out and how is it going to come out and who is it going to come out to. Maybe you can at least give us clarity if one does not have a cell phone or does not have internet access on a broader scale, would you be able to maybe try to open offices or, I don't know, some walk-in so that it becomes accessible to young people who do not have cell phones? That is my only plea to the legislature. I don't know if you're going to do it in 6 months or 2 days or something, but please assist us as young people, because we have been taken advantage of people outside who come in South Africa and access those things when they don't even have to, when they're not supposed to benefit out of those 350. Thank you, leadership.
After him.
Thank you, Chair. Sanbanan. Mina ngizozikhuluma iqiniso, mina ngithanda imali. So into engizoyibuza ukuthi it's been 2 months without payment kuma-350 abantu bawadinga, and you find ama-family kungenamuntu osebenzayo total. So through the starvation of that 2 months, ngifuna ukwazi ukuthi bazothola malini njengoba bathi ayaphuma ngoJune. Is it still going to be 350 or is there increase?
Sanbanani. My name is Ronald. I'm from Kagiso, representing Elinyituba Rehabilitation Center. So I was, regarding the 350 grant reapplication, I was helping a lot of people applying. So we had a problem that most of them, when we applied, it showed that they already exist on the system. And then when we check for the payments, actually there's that page for reviewing, and then you check, and then it says it failed. So I want to understand what is happening there, how to apply for the reapplication again. Thank you.
Okay, Godfrey, can you just respond to the questions from the floor?
Okay, thank you, Honorable Member. Thanks, guest, for the questions. I'm gonna start with the first one, guest number one, whereby the grant was given and taken away without a checkup. Remember when a client comes into an assessment room, you go in that consulting room, it's you and the doctor only. And whatever that transpires within the room is between me and the doctor. So usually the poor doctor finds himself between the rocks, because once you touch the person, once the doctor starts touching them, and then we start getting complaints to say the doctor was touching me and was touching me in a this way and this way. The other one will say the doctor never touched me. But then the question is that when you go to, how many times have we went to the doctor and the doctor never touched us? And remember, when you go to the doctor, for you to be sick is because of the information that you read, is because of your experience, the technical part of it. You don't have to touch a person to see that this person is sick or not sick. You touch a person if you want to apply other things where you would need to do a medical treatment and all those things. But for you to be able to see that the person is sick, it does not really mean that. And our doctors are also relying on information that is also received from the referring doctor, and they confirm that on the client that is there through perhaps interviews. Some of them you touch them, some of them you just look at them because the information is written in there. I mean, let me give an example. If a client is coming there, let's say we have a client that is HIV positive, do you really need to touch a client? You don't have to. You just need to read into the information to say this client, it has been sick for this long, she or he's taking treatment and the CT count is at this level, or the person is not taking treatment or whatsoever. Then as a doctor, I will say, go and take treatment for 3 months. I cannot give you grant for you not to take treatment, because our clients are doing that so that they can look sick or they can feel sick so that they can get a grant. And you cannot default because you want a grant. And our doctors are trained in a way that once you start to default for you to get a grant, they know that you can take some pills for a period of 3 years and you'll be, 3 months and you'll be fine. And remember, disability, according to us, is when you are not able to enter into a market for a period of 6 months. Therefore, if there is a treatment that will be able to make you okay within 6 months, we will refer you to take that particular treatment for that period and you'll be fine. Therefore, you don't deserve a grant. A grant is for people that are not able to get into the market starting from 6 months. So if there are such allegations, they do get reported to us, and they are very specific, and we will conduct interviews between myself and the doctor and the client and to find out as to what is happening. But most of the times we find out that is because the client was receiving a grant and the client is very angry because the person is not given the money again. I'm not saying my guest number one that is the case, but then in most cases it happens like that, to find out that I'm no more getting the grant and this person never touched me, and I'm angry and I start to blow the vessel. So that is the problem. But then if you've got the particulars of that client, please get my numbers from Soli, then I will be able to attend to the case directly. Guest number two, pending, the word pending, and why it takes 3 months, still waiting and not processed, is still saying pending. As I indicated, that there are various institutions that we are dealing with, and we need to verify as to whether, of course, you are not receiving the money or you are receiving the money from somewhere. And it depends as to how speedily are those institutions responding to us, because we don't want to find ourselves being in a problem with the audit to say, Auditor General, why are you paying these people? Why have you paid these people? Whereas these people are not deserving. So the speediness of the institutions that are responding to us in terms of that information is what makes us to put the application on pending, while we are able we are still trying to verify the information, because we are not interfaced directly with those systems as SASSA. We cannot check directly. The only system that we are well interfaced with is Home Affairs. The Home Affairs, if you die today, tomorrow, Home Affairs is telling us that you are dead. We cannot process that grant. That's why even people that are that are passing away, there is no need for you to come and report to us and tell us Godfrey is no more. Our system will automatically lapse. So we are dependent on the interfacing with all those systems. So bear with us. We just need to verify while we are waiting for information from the institutions. So kids that are disabled and physically, do we really need to see them dirty or what? We have been having a problem with kids that are having Down syndrome. I'm sure you are guest number 3. You are referring to that to those kind of clientele. It's very difficult, and working from the space, I also know that it's not easy even for the doctors. And even with the doctors, they do confess that it's not easy, but they have a way of interviewing the kids. They have a way of checking with the parents, and in such instances, parents are even not comfortable once these people are starting to probe further into cases of this nature. I'll just give an example, a very typical example that happened. There was a person that had a child. This person had a Down syndrome, and when the parent brought the child, I mean the adult, for this grant, she said, I will be glad for my child to get the money again, because his daughter needs money for school. And the doctor started to ask, how is a person that is disabled and has a Down syndrome having a child? And that was the case, because the parents started to think that the doctor is saying things that are not appropriate to the child, because he asked why a person that is not disabled is having a child. So there were other things around there. So it's very difficult. But then our legislation has changed now, because our medical professionals, we were only focusing on medical practitioners, meaning general practitioners, GPs. Now our legislation is broadened. With effect from April is broadened. We will be considering also other medical professions. We are talking about radiographers, we are talking about physiotherapists and others, so that they can give us a broader perspective and a broader information. Because if you are a general practitioner, at some point you need a specialist to assist you in identifying as to whether is this person disabled or not disabled. So for us to sort out this issue, guest number 3, I would recommend that you go to your nearest office talk to the local office manager if you've got a group of kids, and so that they can be assessed in a group format, or else when the parent or the child is taken to the doctor, please give them all the necessary information, including the admission to the school and the social worker's report at that school. That assists very well, because our doctors mostly are dependent mostly on the referral form. And if the referral form is very quiet, it's going to be very difficult for the doctor to be able to assess that. This question also, this answer also is applicable to guest number 1, for the client that the money was taken away. That client must ensure that when you go to the doctor, ensure that you get all the medical profiles from every doctor, so that you give your doctor, SASSA doctor, more information, more scope, so that he can be able to see that this person is actually suffering or this person is not disabled. Because the referral letter is just a 1-pager, 6 lines, and it's written by someone else, and if I have that only, I cannot take a decisive direct resolution. So please advise them to do that. The second question, guest number 3, UIF, that has been corrected, as I've mentioned earlier on. Our UIF database now is indicating as to whether is this person receiving UIF or not just a person that is listed on the UIF, as I indicated earlier on. Fourth guest, you've got no cell phones, there is no data, and people not deserving are accessing the grants. We are actually working on the IDs. If you don't have a South African ID, and a cell phone is used for safety purposes, for the one-time PIN, and for you to access, to get a reference, to get the information. And looking at the number and the offices that we are already having with the other grant type, it was not going to be possible for us to say people must go to the office, because those people can be able to assist us and take applications wherever they are. Even now, as I also indicated, that you can make your application for appointment with our doctor online from wherever you are. So that's where we are moving on. We are moving from people coming and getting stuck in the office the whole day, whereas there are other means. Let's try to accept technology. Let's try to move with terms. COVID has shown us that we can do better. We're reviewed to allow people people can apply virtually or wherever they are. Guest number 5, 2 months without the 350. Are we gonna get the increase? The answer to the increase, we are dependent on the direction by our minister. For now, is still 350. And why is 350 without, is 2 months without it? I have indicated earlier on to say people that were getting grants, this 350 until April, is because they were getting, until end of March, is because they were getting the money under the old promulgation, whereby they were getting it because South Africa was under was declared as being under a disaster. But now, because disaster is finished, we are normal now. South Africa is at a normal stage, even though we are aware that it's not normal. So the president and the minister decided that in the meantime, because these people are used to this money, for us to work on them, to assist them on the impact of COVID, what impact has done. We cannot just cut the money immediately. We are extending it until the 31st of March, 2023. So we are applying under a new law. It's no more the old one. Otherwise, you cannot. There was no way we could continue with the old applications. That's the reason why it was cut off, and that's why there was a gap of 2 weeks where people couldn't apply because we were waiting for promulgation of the new legislation. And I think the other one already existing on the system, I'm not sure of that. if you've got particulars or the specifics in terms of the of guest number 6, when a person is applying and the system is saying already existing, probabilities are that that person already applied, so you cannot apply twice. So you can liaise with Putsoli so that he can get your particulars and we can address that directly. Thank you, my leaders. Thank you, honorable members. Thank you, the community.
Yeah, thank you very much, Godfrey, for the comprehensive response. I think it helps to give light to, the work that you are doing. And maybe just to correct you, Soli is from the department, Solin Ndwandwe. The gentleman that you have been interacting with is Sipho, not Soli. Just a slight correction there. Yeah.
My apologies.
Yeah. No, thank you so much for the responses and for the presentation. I think it's very important for our stakeholders and our members to also understand that there has to be checks and balances in everything that we do, especially when it comes to money. We know how some people amongst us can want to beat the system. So if you don't do some checks and balances, hey, sizolimala. Because people will take advantage of the situation and they would come up with fraudulent, means. Some of the people you meet in the robots, some of them pretend to be disabled, yet they are not. They're able to bend their legs and pretend as if they are one-legged, and they're not, some of them. It has been proven, So I think if you've got somebody who's really disadvantaged by the system and you can prove that the person has been disadvantaged, it's proper that you take it up with the department so that the person can really benefit. The checks and balances that are done by the doctors are appropriate. There's this thing of medical boarding. There are people who at times they get maybe involved in an accident and for a period they can't work. And because it's nice to earn when you are sitting at home, they want to continue with the tendency to say, hey, but I can't work anymore, but I want to receive my salary when I'm home. Then they have to go through the process. The doctor must assess them. It's a very long process for the doctor to really declare that you qualify for medical boarding so that you are not allowed to work, but you can earn your salary. So these are the checks and balances that I'm referring to. But I think for the purposes of all the concerns that you might have and for all of you to be able to assist some of the members of the communities in terms of these issues on foster grants or any other grant whatsoever, we've agreed with SIPO that he will create a WhatsApp group for all of you who are here, and that Godfrey will be part of that WhatsApp group. So that if you've got direct questions or direct issues that you want to raise with the department, you are able to do that on the WhatsApp group, and then he can directly assist you or assist your, a beneficiary who is really in need, who doesn't, have the means and the access to do that. So if it's okay with you, SIPO will assist us with the WhatsApp group so that there's that interaction with the department and that assistance can come forth to all of you. We've closed hands. We are not going to take hands outside of the hands. I asked for hands, I got 6 hands, and it's closed. We can't deal on a brainwave. We've got the responses. Otherwise, we won't finish. We will leave here at 8 o'clock, because if I open for one, I must open for everybody, and it can be a conversation that might not even end up here. So we have to have the discipline of a meeting. If we ask for hands, let's get hands, engage, get the responses, move on to the next item. So I'm not going to take up any other hands. The WhatsApp group will resolve the issue if there's an issue. So on this note, members and colleagues and our esteemed guests, our stakeholders, we have actually exhausted the matters that we were supposed to deal with for today. So on that note, we have come to the end of the session. But before we do that, I would request the Honorable Member Magagula to deliver a vote of thanks on behalf of the Portfolio Committee. And I would also request that before you leave, there is tea and biscuits outside. Please have a warm cup of tea before you leave. Ne? Don't just leave it there. Just have your coffee or tea before you go home. So from me, thank you very much for attending this session. You have really been a very good audience and your inputs are very valuable, and we really value your partnership with the Portfolio Committee, and we're looking forward to more engagements on many broad issues, and we really seek your guidance as well, because we exist because of you, you know. So over to you, Member Magagula. You can deliver the vote of thanks. Thanks.
Thank you, Chairperson. Firstly, I would like to thank you as the Chairperson for being a good parent to all of us, and for taking us seriously also that we need to be engaged on our issues which affects us daily. And we hope that in future you won't forget us as this delegation. And we know that we have started this journey together, and we'll finish it together. And looking forward to our last destination. I think won't be the last, but it will be the last only for this conversation on the 2nd of June. Thank you for the invites from our staff, member support staff of the social development, and also for organizing such a venue for us, which it seems that we are very important in front of you, and it makes us to be very important people. Thank you for that, and going forward, we hope that we'll work together in other conversations and in other sectors also. We also thank the Hansard people. We did not have at least in terms of Hansard, unlike in other meetings in some way, where we'll get glitches on Hansard. And also thank you for lastly, I'll thank the participants from the NPOs from all over the Gauteng, in all the regions. Your input were valid and has given us more sense that where we were lacking, we were prepared to work to improve in future, and we are prepared to work with you going forward. And whenever you've got you experience challenges, we are here for you, and working with you going forward. I hope that when we go back to our organizations, we'll reflect on what has taken place today. And we also thank the department in absentia for availing themselves with the information they've given us in this house. With that notes, I'll say drive safely back home, and also we meet in the future as we're still here, and we'll ask God to be with us, and as He has done so far, when other people did not survive on the pandemic, but because He likes us and because we pray and trust in Him, we're still here. drive safely back home, and goodbye. See you when we see each other next time. Thank you.